Good afternoon and welcome to our second round of budget hearings. It's August 8th, 2017, and our first order of business is approval of minutes from our budget hearing of last Tuesday. Could I have a motion?
So moved.
Okay, and a second? Okay, we've had a motion by Councilor Rolfing and a second by Councilor Erickson. Or do we want to do a roll call vote? All in favor say aye.
Aye.
Okay, that passes unanimously. To start us off and to kick us off again this afternoon, as he did last Tuesday, to a very successful start, I might add, is Director Turbach, our Director of Finance, and he's going to be talking to us about the entertainment tax. Welcome.
Yeah. Thank you. Tracy Turbach with the Finance Office. Good to be back again for round two here. One down and two to go. I'll be talking, as you mentioned, about the entertainment tax fund today. The entertainment tax is the name we give to the 1% sales tax that's applied to the sale of lodging accommodations, prepared food, alcoholic beverages, and ticketed entertainment events. That 1% tax on those sales last year generated about $7.4 million. We're expecting that to be about where 2017 ends. And the 2018 budget is based on a 1% budgeted growth in that revenue source. As you folks know, the use of these dollars then that are generated from the entertainment tax is restricted by state law and by city ordinance. We use it to support our entertainment venues. So taking a high-level look at the proposed 2018 budget for the entertainment tax, it's really comprised of four main parts: the events complex, the Orpheum Theater, the Sioux Falls Stadium, and the Washington Pavilion. And you can see the total overall increase proposed for 2018 is $2.5 million. That's largely driven by some of the larger repair and maintenance projects and capital projects that are in the 2018 proposed budget, particularly at the stadium and at the pavilion, and we'll dig into those a little more as we go along. So looking at this first part of the entertainment tax budget, it is for the events complex, which is comprised of our new Denny Sanford Premier Center arena, the convention center, and then of course our old arena. These venues are under third-party management. They're managed by SMG, as you folks know, and Spectra provides the food and beverage services at these venues. The contracts with SMG and with Spectra expire at the end of 2017, so we have been in contract renegotiations with both of those companies, and we expect successor contracts to come before the council this fall for your approval. Looking at the overall budget for the events complex expenditures for 2018, you can see the total in this area is up about $700,000 as proposed. The operating, which represents about $700,000 of the $3.2 million budget, is comprised of several parts. As with all of our managed facilities, the city retains the responsibility for property insurance, so those are budgeted within the entertainment tax budget, those premiums. And then the larger repair and maintenance projects, anything essentially over $2,500 is funded from the entertainment tax dollars, and those are projects that we budget for as a city rather than having our third-party managers take responsibility for those. In the case of the events complex, some of the larger repair and maintenance projects in 2018 include parking lot repairs, some floor covering replacements, HVAC repairs, and painting. So you see there's nothing too exciting in there. It's pretty much taking good care of the facilities that we have so that we can maintain the high quality of the venues that we do have. The capital portion of the budget is $2.5 million for these three venues for 2018. You can see kind of a summary here of the projects that are proposed. The lion's share of it is in the convention center. We'll be making some additional investments in the convention center for HVAC improvements, lighting upgrades, and then another phase of the kitchen remodel. Some retention pond improvements and fencing improvements at the event center facility, and then about $400,000 for some equipment. Those are all outlined in your capital, in your budget book Starting on page 74, I think the list of capital is on about page 75 or so. Moving on then to the Orpheum Theater. This venue is also managed by SMG with food and beverage services provided by Spectra. Not a lot happening in the 2018 budget compared to the 2017. You can see that no changes proposed at all for the Orpheum. A very small amount, about $70,000 for capital improvements for some HVAC upgrades. And then if you're familiar with the Orpheum, you know there's that kind of a courtyard there with cobblestones in it. They'd like to make some improvements there to enhance the usability of that space so that they can, it's really some kind of interesting, unique space, but it really is underutilized because of the footing out there. Moving on to the next area of the entertainment tax budget is the Sioux Falls Stadium. We have been transitioning this facility into the entertainment tax fund over the past few years to remove the burden from the general fund and the second penny sales tax fund for ongoing maintenance and repairs and capital improvements on this facility. So it's kind of been a success story over a number of years. If you go back just a few years in the city budget, you'll see in the general fund the city general tax dollars were supporting the operations of the arena, the operations of the Orpheum. Most recently, you would still see operating costs related to the stadium. All of those are transitioning to that entertainment tax, so that we're no longer using general tax dollars to support those venues. The stadium is not currently under third-party management contract. However, we have been talking with both SMG and with Spectra about incorporating the stadium into their management agreements with the city. So at this point, although negotiations haven't been completed, I do expect that we will propose putting the stadium under these third-party management contracts when they come before you in the fall. And really the driving reason behind that, we think there's some untapped potential for some added events and revenue generating opportunities at the stadium that we haven't been capturing in the past. So we think there's some potential there to generate some additional revenues and step up the utilization of this facility in the future by engaging our professional management companies to do that. Looking at the numbers for the stadium, you can see the operating and capital total up to about $800,000 for 2018. That's a significant increase this year of about $600,000. The operating is really driven by repairs and maintenance. Last year, we had an outside assessment, kind of a top-to-bottom review done of the stadium facility and identified a number of maintenance items that we want to take care of. Some exciting stuff like tuck pointing and concrete repairs. Those types of things are what we're looking at doing as some of the top priorities that came out of that assessment. The capital project at the stadium is in the current plan, and we'll be executing the implementation phase of that next year, and that's for the locker room renovation that's being designed out of this year's budget and will be constructed next year. Lastly then, the Washington Pavilion is the final part of the entertainment tax fund budget. This facility, as you know, is also under a third-party manager, Washington Pavilion, Inc., as you folks know. And I should mention, too, that there are representatives here from the Pavilion as well as SMG and Spectra. So if you ask questions at the end that I can't answer, I might have to rely on those folks to bail me out. But this contract with Washington Pavilion, Inc. also expires at the end of the year. And so we have had some discussions with Washington Pavilion, Inc. and expect a successor contract, again, in this case, to come before the council this fall for approval. Looking at the expenditures proposed in the city's budget for the pavilion, a total of $4.7 million. That's a significant increase, primarily related to those larger repair and maintenance projects, and you can see a significant increase in capital budget for the pavilion. And here again, the city budgets for the property insurance, the larger repair and maintenance projects like floor covering is a big one that's we'll be finishing up next year. We've been on about a 3 or 4 year program to replace all the floor coverings in the entire facility. And 2018 we'll will be the last phase of that project. We've also budgeted for some lighting replacements and upgrades, and again, some HVAC repairs and maintenance. A large part of that operating budget is the operating contract with Washington Pavilion, Inc. There is no proposed increase for 2018 for their operating contract fee. We also budget to support some traveling shows and exhibits as those opportunities become available. So all those things are part of that $2.8 million proposed operating budget. In addition, the capital of 1.9 is a fairly big capital year for the pavilion. We do have some building improvements, the retaining wall and electrical upgrades, as well as some equipment, about $800,000 worth of equipment and exhibits planned for 2018, and those again are detailed in your book. So that really covers the entertainment tax budget. I do want to take just a minute and make a few comments as we look to the future. As I mentioned, all of our third-party management contracts do expire at the end of the year, so we'll be bringing those forward to you soon for your consideration and approval. And as I mentioned, one significant change that I expect we will be proposing is to fold the stadium management and food and beverage services under the SMG and the Spectra agreements for that facility. We do expect the event center to continue to operate in the black. That's certainly been incredibly beneficial for our entertainment tax fund and the entertainment venues that we have. That positive income from the event center helps to support the operations of those other venues, allows us to invest back into all of our entertainment venues. And as I mentioned earlier, it also helps to relieve the general fund from the financial burden of supporting the operations of all these facilities. And as I say, the stadium now will be rolled completely into the events or the entertainment tax fund. Having that event center operate in the black also helps position the city well should revenues from our venues fall off or we have unexpected costs encountered along the way. It is, I think, a good time, and we're planning to evaluate the future of the old arena as we go forward. We've got a few years under our belt now with the event center, and I think have a little better understanding of the synergy with that facility. The current utilization of the old arena is somewhat limited. It is used for some of the large flat floor events, some of the big trade shows and so forth. You folks know Augustana basketball utilizes the old arena, and a number of other events are held there. However, it still is not fully utilized, I would say. So we will soon be proposing to engage a consultant to evaluate the potential long-term possibilities for the arena. I think we want to develop kind of a long-term direction of what we're going to do with that facility, what the city will plan to do for that in the future. So you can watch for that contract to come before you in the near future. And kind of as a side note, in the capital program, you'll see any capital spending that we had in the plan for 18 relating to the arena. We did push out, kind of waiting for this feasibility analysis to be completed before we start to invest significant dollars into the facility to make some improvements. So we want to kind of know what direction we're headed with that facility from this study, and then we'll make some longer-term decisions relative to investing in it. So with that, I will open it up for whatever questions you folks have in your mind today.
Thank you, Director Turback. Any questions for the Director? Councilor Staley.
Thank you. I wanted to go to the statement you made about the Sioux Falls Stadium, Tracy, and you said that you had been working to shift that from the general fund to the entertainment tax, correct?
That's correct.
What defines what entity can be shifted into that entertainment tax?
It's the use of those dollars are controlled by state law and by city ordinance.
So this is was it under the Parks Department before?
The Parks Department is currently responsible for the stadium, yes.
So just humor me here that we could feasibly moving forward, would it be possible to move other facilities such as the Great Bear, the zoo, or maybe the Midco Aquatic Center from general fund into entertainment tax as well?
I think the answer to that is probably yes or no, or yes and no. Some of them that you mentioned, I believe, would fall under the current ordinance and some would not. So it just depends on the specifics of what we might be looking at.
But would it be safe to say anything within the Parks Department's oversight could move into that area if needed?
I wouldn't go so far to say that anything under the Parks Department. Certainly, some venues are, if they're, I think just a general rule of thumb, if they're the kind of facility that has ticketed events that are subject to the entertainment tax, there's a good likelihood that that would be an eligible facility to help be supported by that entertainment tax.
Thank you.
So just in general, the average park doesn't generate any entertainment tax revenue, so it probably wouldn't be appropriate to use entertainment tax dollars for a park, for example. But if it's a facility that's generating entertainment tax dollars, that's just kind of a rule of thumb. But your question really is more of a legal question that we'd have to look at the specifics.
Well, how about like the soccer tournament, when you're bringing in income?
I don't believe they charge a ticket fee to get into a soccer tournament.
There is some money exchanged.
I guess I'm not familiar with that.
All right, thank you.
Councillor Erickson.
And Councilor Ruffing might be able to address what money is exchanged for the soccer tournament, but that's done with an outside agency versus money exchanged in a ticketed kind of fashion. So that might be a little bit different. But I had somebody ask me the other day if the Levitt Shell would fall under an entertainment venue. I know they're not planning on charging, but is that something? Probably not. That's not on the table anyways.
Yeah, I'm not sure what to say about the Levitt. The events are intended to be free, so they won't be selling tickets,
Right.
At least as a general rule. There may be some exceptions to that. I don't know. The other thing is the costs associated with operating it are really not intended to be the responsibility of the city. The shows that are put on, the programs, the production of all those things is really intended to be done by the local Friends of the Levitt. The city will have some minor responsibilities in terms of upkeep and maintenance of the grounds and that kind of thing.
If I can have one more follow-up.
Absolutely.
So my other question is in regards to the stadium as well as, I know you mentioned transitioning that to a different management group, if you will. So my question is, right now there's the office in there for the Canaries and the Stampede. I don't know if they would still stay there or if that would be all under the discretion of SMG and SMG would then take over the Canaries and all of that, or is it just a sublease? I mean, I know it's a little maybe premature to have that conversation, but I'd be certainly interested in knowing what's going to happen with those that occupy those offices right now. And
No, that's a good question. The Canaries organization does have a lease for that facility, so that nothing that we're proposing would impact their ability to exercise the rights under the lease, so they would continue to be a tenant just like they are today. We have met with the Canaries folks earlier this spring. We met with them to just kind of talk about the concept and get their sense of kind of what they thought from their perspective if we made that kind of change. And they were very favorable to that. They felt like the SMG, and of course Spectra serves them now, provides food and beverage services for the club events out there. So that wouldn't change. This proposal wouldn't change at all. But they did feel like there was some maybe potential expertise that they could tap into from SMG that might actually be beneficial to the Canaries. They have rights under the lease to hold other events besides their baseball game. So I think they feel good about making that change. They'll have somebody right on site there that they can go to if they've got concerns or issues or problems. So they were very, very supportive of making that kind of a change.
if someone wanted to rent out the Canary Stadium for a baseball tournament or host a championship high school game there or something, can that be done, or is that not something that can be subleased, so to speak?
Yeah, I think it can probably be done. The question I think would be whether you would have to work with the Canaries or with the city. Under the lease agreement the city has with the Canaries, the city does have some limited rights to host events and put on events of our own within the stadium, but those rights are limited under the agreement where the club has their own rights. So it would kind of depend on where that would fall, and that's what I think would be a real advantage for the Canaries and the SMG both to be on on the same site there, essentially just across the parking lot from each other, and be able to work together on those kinds of things. And SMG is pretty excited about the prospect of actually utilizing some of the rights the city has under the Canaries lease, which we have not done in the past, to hold events out there and, as I say, tap into some of those potential revenue generating opportunities.
Thank you.
Councillor Starr?
Yes, thank you, Mr. Chairman. Director Turbuck, one of the questions that came up with one of my breakfast groups the other day is we were talking about the event center, the Denny Sanford Event Center, and where the use of the settlement money for the siding was used. And so I had a constituent ask me, where was that $1 million used, or have we used it, and where would it fit into the budget moving forward? Because they were kind of under the impression that it would be in a reserve fund for future repairs. And so give me an idea of where we have that money, or if we've used it, and how we would use it moving forward if we haven't used it.
Sure. There was never an intention to set up any sort of reserve fund or plan for the eventual repairs or replacement of the siding. That was never an intention of the city. All of the funds related to the event center project went into what we call a capital projects fund. In your monthly report, it's identified as the event center construction fund, I believe. And so the proceeds from the bond sale went in there. We had some donations for the project that went into that fund. Any cash that we received, including legal settlements, would have gone into that same event center construction fund. And so those dollars are still in that fund. And if you look in your monthly report, you'll see there are dollars left. We've talked about that recently, about what happens to the leftover money in there. And the 2018 budget does contemplate closing out that construction fund before the end of 2018. So we do anticipate there will be cash left in that fund that will then, in effect, be transferred as that fund is closed out. Any remaining balance would go to our sales tax fund and then be utilized to make the next payment on the event center bonds.
So it'd be fair for me to say, or to tell this constituent, that the settlement money is going to be used to pay off bonds for the event center, or just sales tax bonds in general?
Now, they're one and the same. I guess I like to keep the two tied together. That would be my intention, that they would be thought process that they would be used to pay for the event center bonds. All those payments come due at the same time. They all come out of the same fund. So I guess you can look at it any way you choose, but in effect, I think that would be an accurate way to put it.
Thank you.
Councillor Staley.
Back to the Levitt question, I remember our Parks Director, Don Kearney, at the press conference when it was announced, I asked him about the operational cost for that, and he was thinking it was going to be about $75,000 a year. So coming back to this entertainment tax and the Sioux Falls Stadium, are some of the operational costs coming out of the entertainment tax for that?
Well, we do have some costs associated with the maintenance and upkeep of the stadium, that will be paid now from the entertainment tax.
So Councilor Erickson's question about that would be relative to putting this into the entertainment tax as well.
I think we could certainly take a look at it. That's not necessarily
for the 75.
Something that I would advocate standing here today. I think it would take a lot more thought and forethought to start making decisions to throw additional venues in here.
Well, except as we're moving forward, we're also having to alleviate the pressure being put on the general fund for operational costs across the board. We're cutting programs within the Parks Department, so that I think could be, as we move forward, we might need to look at all possibilities.
Yeah, I'm well aware of that, and that was part of the motivation, certainly, to transition the stadium in there. The reason the stadium made perfect sense is because of its location, for one, the type of events that are there. It's not something where the city is out there on a daily basis putting on programs or activities. It's not something the general public has access to. It is really intended as an entertainment event facility. And it makes sense, I think, from a management standpoint because of the proximity to the arena, the convention center, and the Premier Center to roll that all management and consideration of that facility all into one complex.
Any other questions for Director Turback? Well, Director, thank you very much, and thank you for listing the page numbers that are associated with your presentation and our budget books. That is very useful, and as you stated, we're limited in terms of how we can use the entertainment tax revenue, but I do appreciate you looking into the possibilities on how that can be used with some of these other venues in the future. You had mentioned our event center, our new event center is operating in the black, which is fantastic. That's kind of unheard of, is it not?
It is very exceptional. I wouldn't say it's absolutely unheard of. I think there are venues around the country that, particularly newer venues, that do operate in the black. At night when I'm having trouble sleeping, I wonder how long the honeymoon is going to last. But you know, by the end of 2016, the honeymoon was supposed to have been over. But you know, as you've seen in recent announcements and ticket sales, I mean, the public is just very, very supportive of the facility. So we're going to do everything we can, and I know SMG and Spectre will as well, to keep the good times rolling just as long as we absolutely can.
Well, hopefully Garth Brooks is acting as a sleep aid
September
for you.
is set to be a very good month, I think.
Okay. Director Turback, thank you very
thank you.
much for your presentation. Up next is a report on our budget from Director Jill Franken, Director of Public Health. And welcome, Director Franken.
Thank you. Yes, Jill Franken, Health Director with the City of Sioux Falls. I really appreciate this opportunity before you this afternoon. And I want to thank in particular Tim Conda and Amy Richardson for the work that they did preparing this budget, as well as Alicia Klura and the health management team in informing the budget. So let's go ahead and get started. So this is a snapshot of the programs and services that are provided for our community by the public health team members who provide primary care services. They provide health promotion, disease prevention, as well as mitigate health threats in our community. We have a host of professional, technical, certified staff, as well as contracted partners who make up the 130 folks that serve this community through the Public Health Department. Programs and services that we provide use national standards. We use best practice, evidence-based to provide the access to services while doing so with high quality and expert efficiency. This team also, particularly the clinical services, bases the work that we do on current and emerging needs of the community. We're data-driven in our decision-making, and we also measure quality and benchmark our services that we provide. An example of this would be the fact that Falls Community Health is only one of 6 clinics in the state who has the recognition of being a level 3 patient-centered medical home. That's a specific designation at the national level, and we're one of 6 in the state that have that highest level of designation, which assures our patients and those that are looking to be served by Falls Community Health that we have certain elements that make us patient-centered and provide that specific type of care. In addition, a few examples of performance this past year I want to just note include we increased our dental services at our Hayward school-based clinic. I know that's of particular interest to some of you. We also, as you're well aware, expanded our smoke-free spaces, and tobacco-free youth is a city ordinance now. In 2016, we completed yet another community health needs assessment, this time in partnership, producing one report with Sanford Navera Health. Project NICE, I want to tell you, this year we took away 1,260 tons of waste this last Project NICE and Keep. That equated to 157 tons a day of cleanup from our neighborhoods that we targeted. That's the most tons we've ever removed and the highest tonnage per day in the last 7 years of this program. So I thought that was notable. Overall, this team's passion, mission-mindedness, expertise, and focus on quality and performance, I believe, is commendable. So on page 49 of your budget book, you can see the department overview, including revenue sources. When you see charges for services, that top line there, this increase is primarily in the Falls Community Health Program through things like increased patient visits, as well as additional grant funding, specifically in the behavioral health area. Our federal grant, which is the majority of the next item down, provides fundamental access to our primary care at Falls Community Health so that those 13,000 patients, about 50% who are uninsured, are eligible for the wide range of services that we provide and are eligible for that at a sliding fee discount based on the federal poverty guidelines. We also receive a variety of grants and contracts, examples of which they help us to promote health and prevent chronic disease and prevent communicable disease, as well as provide some level of our mosquito control, and also our partnership with the state for restaurant licensing and inspection and provide revenues in that area. Also of note is how important it is for us on a revenue side to really maximize our capability to be reimbursed at the fullest level through our third-party payers in the clinical area. So we're always working to maximize that as well. So on page 50 then, you'll see expenses broken down by program, as noted also on this slide. So how do we allocate the resources, and how have we estimated that we're going to need, what resources we'll need in 2018? Well, as you can see, in 9 of the 10 programs that we have, they have remained, they basically have remained flat from a budget perspective on the expense side from 2017 to 2018. The only change to our budget really is in that top line, and that's Falls Community Health Program. That increase is driven primarily by costs incurred when we increase our visits, our patient visits, as well as for part-time staff that we're adding with the $75,000 expansion grant I alluded to earlier for behavioral health services. So bottom line on this, I just want to make clear that on the revenue side, clinically, we're seeing $627,000 in increased revenues. Then we're seeing expenses increase on the clinical side of $347,000. This is resulting in a net decrease of the general fund projected from 17 to 18 budget of $280,000. So all good. It's a good thing. We're bringing in more revenue, costing less to do so, and still being able to maximize all our services and provide a little bit more in the behavioral health area. So breakdown of the operating budget by category, just to give you a little more information on a couple of particular areas. On the personnel side, we are seeing an increase, about $288,000. Those are primarily things like cost of living, step increases, some of our benefits. Health insurance is going up this year. I think that's already been shared with you in the HR presentation. But the substantive change is in personnel, which is recommended for 2018, and that is that 2 new behavioral health service providers or licensed clinical social worker FTEs. Through additional grant funding, I've alluded to now a couple times, as well as we moved expense from our professional contract section or professional services to personnel, we're able to recommend this change, which actually becomes a budget neutral item. And so this is why we felt it was a really good move on our part to do so. So this is actually what this will do for us in the clinical services. It's going to allow us to expand our mental health counseling, our chemical dependency services, as well as some of our psychiatry time, which is desperately needed in this community and for our patients. It's also going to provide us to do some staff development. We have there's some best practice out there in working with trauma-informed care, and we want to be able to do additional training for our staff to be able to provide that trauma-informed care for people like, for example, those who are survivors of human trafficking, our refugee population that comes here from our other countries, as well as our homeless population. We're also going to do some things like reach out to Bishop Dudley Hospitality House for our chemical dependency counseling. We're going to do more outreach in that area as well. And then a couple other things we're going to be doing is we're seeing an increase in our medication-assisted therapy for opioid addiction. We have several staff. Our chief medical officer is trained to be able to provide that. It's some of you might have heard it called Suboxone therapy for opioid addiction, and there's an increasing demand for that. And what would be really helpful for us is to have a chemical dependency counselor paired with our medical provider to be able to work together with those patients. We feel that's a better avenue, and we haven't had enough CD counseling to be able to really do that fully with the demand that we're seeing for that service. And then lastly, there's just increasing need for our patients to have peer-to-peer counseling and support groups, and so we're going to do some pilot testing to see if there's demand out there. We think there is, and we think that we can bring that to our patients, and that will be successful for especially our opioid-addicted patients. So from the clinical perspective, just to give you some reasons why we want to do this, I do think it's pretty evident why. There's increasing needs in our community for behavioral health services. We've been working with our partners across the community and really identified that to be so. But also within the clinic itself, depression and anxiety are our top two. They're two of the top 5 diagnoses we have in our clinic. So that's pretty telling when you think about the service need. Opioid addiction, is increasing nationally, and as I said before, the demand is increasing at Falls. We also are working to be more fully integrated with behavioral health services in our clinic. We want to make sure that all our primary care providers are fully trained and feel well educated to provide mental health services at that primary care visit, and bring that expertise of the behavioral health services providers, those counselors, in for that warm handoff. And that's really best practice, and we're aiming to be fully integrated in that area. I also know it's really a strong desire of several of you to see responsiveness to the mental health needs in our community. And I believe this is a step in that direction. Many people in our community depend on Falls Community Health for their care, and this is one way that we'll be able to provide increased level of the services needed for our patients and for the community. So there's some additional operating costs that are increasing slightly. Our interpreter costs are increasing. Our lab and x-ray fees are increasing. Most of this is related to those increased visits that we're estimating that we'll have in 2018. Some supplies, pharmaceuticals in the clinical area are increasing. Our utility rates are actually going down, estimated to go down next year, so we'll see a little bit of a decrease there. And that really is, in a nutshell, our budget. It's lean, but it's also responsive to the needs of Sioux Falls. We have and will continue to tap into every possible resource to best serve this community. And some final thoughts that I have for you are that this team, my team, our team, your team, really works to be efficient and effective in providing this service delivery. That's efficient, effective, and it does result in quality that's prioritized and advanced, grants that are stable and increased due to grant compliance. Our revenues are increasing, and general fund actually then decreases as a result. Patient access continues to increase, and we continue to work to do so to meet the demand. Public health policy is advanced, which optimizes community health, and public health threats are mitigated. So thank you for this opportunity, and I and my team are here to answer any questions you might have. Thank you.
Councilor Neitzer.
First of all, I'm very excited to see the expansion in mental health assistance. We know how much that impacts people's lives in a negative way, and being able to function and homelessness. There's a lot of that in that community. Mm-hmm. The first question is, you sort of made reference to it. Do you have psychiatrists or psychologists on staff?
Yes, we do.
You do?
Yes,
okay.
we do.
Great.
We have psychiatry, albeit limited, because of what we have are available expense allocation for that, but that's one of the areas that'll be increasing. Right now, I believe it's 8 hours a week that we have, and we'll be increasing that additional 4 hours a week. We've been utilizing a combination of either psychiatrists or psychiatric nurse practitioners to provide that service. And so one of the things I'm excited about is we're engaging a partnership to try and work towards working with SDSU College of Nursing and their nurse practitioner program to actually see how we can partner with them to bring more psychiatry to the clinic and provide that education experience for those students.
And then my other question would be, if somebody's having a mental health crisis, you feel like you need help right now. And so, if we can't see you for a few days, if you're a private payer, you can go to somewhere like Avera on 69th, and they have, the crisis department and things like that. But do you have something like that if somebody comes in and because otherwise they're going to end up in the emergency room if somebody's having an anxiety attack, and many times that's where they'll end up. If somebody walks in the door, do you have the resources to provide an immediate counseling, some sort of help? Or?
We would immediately try and help them in any way we could. We have our social workers have a great knowledge around how to assess someone, as well as our mental health. We almost always have a mental health counselor, and oftentimes have a CD counselor somewhere in the building or around. And so, or they will be seen by a medical provider, and they will do an initial assessment. There's a lot that they certainly can do as well, and it's actually part of being a patient-centered medical home that you have a certain amount of open access so that someone that comes that same day is able to be seen, and so that's something that we provide, yes.
Okay, great, thank you.
Councillor Selber.
Thank you, Mr. Chairman. Thank you, Director Franken.
Sure.
I liked your one comment, more revenue and costing less to do so. That's a nice combination. When you see this continued rise in depression and anxiety and the opioid use and all these different things that seem to just keep growing astronomically, now you combine that with trying to run a tight budget. Is your team, staff and personnel getting pretty well stretched, or are they keeping up with the load for the most part? I know there's a lot of different areas there. Maybe it's a broad question, but we keep hearing about how things are skyrocketing.
Well, I'd love to stand here and tell you we're just fine. But I talk with our chief medical officer regularly, and Alicia and the rest of the team operationally, and it is a fine balancing act, meeting all of the needs of this community, especially when you see those emerging issues starting to take shape, because they are extremely complex individuals that we're serving. When you talk about having perhaps even a combination of a mental health issue as well as then an addiction, which there is plenty of that we are treating. When they have both things happening almost at the same time, someone is maybe trying to medicate themselves through medication that they probably shouldn't be taking that can help make them feel better in their minds while they're dealing with this crisis, mental health crisis. And so I believe we have the resources we need. We always have to balance. There's always going to be demand that we have to keep working to try and meet for this community, and that's why we're always looking for opportunities to access additional funds. And we're not shy to talk with folks like the State Department of Health and say, hey, you know what, for example, we're seeing more sexually transmitted diseases in this community. What can you do to help us provide more testing opportunities? Can you help us with some of that? And they say, yeah, you bet, we can help you with that. So it's really keeping an eye on what you need and then knowing the resources of where to ask for that. But we are always paying attention to where our staff are stretched, because that is something that we have to be mindful of. Yeah.
Right. Well, appreciate all that your department has to handle and balance. So
Thank you.
Thank you.
Councillor Erickson.
Thank you. Two questions that I have. One is, we've talked about the EMS system fines. What area does that go into? I know I see on here it says miscellaneous fines and contributions. Is that where that?
I would say that's probably where it is, yes.
Okay.
Yes.
I just was curious with that, as I've seen it go up a little bit over the years, and so that's something that you're able to level out your budget as well. So the other question I had is in regards to looking at the community health and wellness. Talk to me a little bit about what that role is on that particular line item, and if we've really looked at a return on our investment on that area.
Absolutely. That is, when you think of Live Well Sioux Falls and all the work we've done with healthy community design, with our trying to decrease tobacco use, with doing things like the big squeeze and identifying where we're at with our hypertension efforts and promoting decreasing hypertension in our community, with our efforts to look at our food through developing our food councils and looking at ways that we can provide access to healthy nutrition in areas where we may have a gap in our communities and where we can increase fruits and vegetable consumption in our community. The tobacco policy, that was a big focus of effort. And then also working on our assessments that we do every 3 years. That takes a tremendous amount of resource for us to be able to provide that picture of what's going on in the community, work with our health system partners on that. So just off the top of my head, those are the things that we're engaged in, and many other activities as well.
Thank you.
You bet.
Councilor Erpenbach.
Thank you. Thank you, Director Franken. It's always good to hear all of this. I have to confess that I've always been surprised. Every time you report to us, I'm always surprised that the city is involved so deeply in the health of our citizens. And so my first question was going to be, are we the only ones? And so I just Googled real quick, community health in South Dakota, and just about every county has some sort of health office. But many of them provide only like women, infants, and children, or family planning, those sort of real basic things. They're not providing the level of services that the City of Sioux Falls provides through a health clinic like we do. So talk to me about how that, the people that you see, are they all Sioux Falls residents? Where are they from? And how do we balance, how do we figure out, I'm kind of thinking about what Councilor Selberg is asking you about your staff and the level of work that we have. How do we balance all of that, the needs of not just Sioux Falls people, but beyond?
Sure. Well, it's a good question that you're asking, because our federal grant does require us to provide care to anyone, to be an open door, to not turn away anyone that would seek care. And that's something that this council and administrations and councils before you have been very committed to, actually since 1979 was when first decided to develop a community health center here, and that was at the very beginnings of the health center movement. And so that's a requirement. So yes, we do see some people outside of Sioux Falls. They may be in a zip code that's just surrounding Sioux Falls. They might work here but not live here. But then there are very few who actually live farther away. When we first opened our dental clinics about, it's almost 15 years ago now, we were seeing people from a distance away that could not get any health care in their county or in their region of the state coming to us begging for services for their child or themselves. And our Ryan White Part 3, our Ryan White program, which is an early intervention program and ways that we can provide primary care to patients with HIV, is actually providing care to East River, South Dakota, people who are afflicted and diagnosed with HIV or AIDS. So those are some interesting pieces to the programs that we provide services to the community greater than Sioux Falls for. But they're federally required, mandated of us, and it's been a commitment that we've had. And those dollars have leveraged the opportunity for us to provide access to care in our community that if we weren't here providing it, it would be really pretty amazing to think of what kind of issues we'd be facing with people not being able to get access to primary care and how expensive it would be for all those individuals seeking those services in the EDs or not getting that care at all. So as far as balancing it, we just have a great team. I mean, it's a pretty exceptional group of individuals, and our partnerships are so important. An example of that would be Center for Family Medicine and the partnership that we've had, which has ebbed and flowed over the years, but it is the best it's ever been. And having those residents, the second and third year residents coming and practicing here, and then perhaps some of them decide then to work in community health centers, which is awesome. And so those are things that we feel really proud of, and we're really pleased with the way we've been able to leverage partnerships, work with others, the federal grants and contracts that we have to be able to provide the services in Sioux Falls, some, though, that reside outside of Sioux Falls.
I just think that's really interesting, and to try to imagine what it would be like if we took that community health center out of the equation in the Sioux Falls economy at this point. I'm not sure what that would mean. That's a frightening thought, really.
Absolutely.
Then just a rabbit hole. I was at a meeting with some citizens the other day, and they started talking about being on vacation somewhere else and being attacked by mosquitoes. And I have to tell you that I was one of those people early on that went, I don't want them spraying my neighborhood. I absolutely don't. I'm terrified it's going to kill all the good bugs, all that stuff, everything that we all complained about. But this person was like, that is one of the greatest things Sioux Falls does for its citizens is that spraying program. And we literally look forward to it, and we're grateful for it. And I'm like, really? I didn't ask these people anything. They just were dumping this on me. So I'm like, you need to hear that. It's awesome.
Thank you.
Glad to see it's still a line item, so thanks.
Thank you.
I appreciate it.
Thank you.
Are there any other questions? Director Franken, I know from my time serving on your board prior to my becoming a city councilor that you were forever challenged with an increasing number of visits, and I see with the over 42,000 clinic visits that continues to increase, and serving 12,712 different individuals, patients. That actually averages out to about 3.3 visits per year, which when I think about it and the number of times I personally go see my physician, that's probably pretty average for what I would see, which also indicates that at least we're not dealing with chronic problems. We probably are with some. However, I do know the role of prevention in the services that you provide, and you do a great job because it's a great investment preventing something versus trying to treat it once it's already established itself. So great job on that front. And I'd just like to echo what a number of counselors, Counselor Selberg and Erickson and Erpenbach, so adequately stated. It's the listing of by program. I mean, you have 10 different programs listed here, so that just goes to illustrate the broad range of your responsibilities. And I do know from my personal experience, it's not necessarily just limited to these as well, too. And I'm glad to hear the emphasis on staff development, especially in the medical field, where things and problems and issues are changing almost on a daily basis, the number of challenges that you and your staff face on a daily basis. And I do know, too, that with the under the other operating expenses, continued increased need for interpreter services. As a former teacher, we certainly saw that within the public school system as well. And that's probably not going to let up any time too soon. So you continue to manage, as Councilor Selberg was asking you, you continue to manage with basically, when you consider the increases in supplies and visits, you continue to manage with really without a increase in funding. So it's pretty amazing, the services that you provide, and I thank you for that. And I would encourage my fellow counselors, if you have not visited Falls Community Health Center and our other satellite clinics, Hayward Elementary and Hawthorne Elementary and Terry Redland, please do so. It's a real eye-opener, the level of services that we, the city, provide citizens that need it the most. So thank you very much.
Thank you. Thank you all.
Next up, Parks and Recreation budget presented by Director of Parks and Recreation, Don Kearney. Welcome, Don.
Good afternoon, City Council members. Appreciate the opportunity to present our 2018 budget to you this afternoon. I do want to thank the finance team and our Parks and Rec team for their assistance pulling all this together, namely Tom Huber from finance, who seems like he lives in our department most of the time, but he's been very helpful to us, and along with the rest of the finance team. I also wanted to thank the City Council for your support for the programs and services we provide. You know, I often tell people that without the community support, which starts with the mayor and the City Council, our park system wouldn't be what it is today. And that goes for other previous mayors and previous councils and the support along the way. We can have all the best ideas and the best staff, and really none of that really matters unless we have the resources to be able to pull it all off. So again, thank you. I thought I'd start a little bit about how we're investing $25.9 million in our Parks and Recreation services. And I thought it'd be good for not only the City Council to see that again, but also the community if they're watching as well. Oftentimes it does come as a surprise for people to learn about the different types of programs and services we offer. Oftentimes new Parks and Rec Board members get an eye-opener when they understand the scope of the things that we're involved in and what it really takes to be able to deliver a comprehensive Parks and Rec system. And a lot of that has to do with the collaborations that we have across the city and our partners across the city to really do some things that we would really, not be able to do by ourselves. There are nearly 2,500 acres of developed parkland spread across 80 developed parks for the community to enjoy. And as many of you know, one of our planning goals is to provide a park within a half mile of every residence. So regardless of where you live in our city, there's likely to be a park within walking or biking distance. We're really fortunate to live in a city with nearly 30 miles of paved off-street multi-use trails, with more trails being planned for the future to accommodate the growth and development of the community. We also have 72 playgrounds spread out across the city, and they're likely located next to one of our 82 tennis and basketball courts or near one of our 180 athletic fields. We have 7 outdoor and 1 indoor aquatic facility which are projected to serve over 500,000 people in 2017. And our community centers and our large gyms continue to be a source of great year-round activity with 230 to 255,000 attendees annually. I'd also point out that while we have become leaner as a department in these slower revenue times, we are still offering a robust list of programs and services. Namely, if you looked at our activities guide, you'd find essentially something for everyone in that activities guide at extremely affordable prices. I also wanted to acknowledge the special events process that we facilitate along with many other city departments in city parks and on city property. And certainly our effort obviously is to coordinate those so that everybody goes home safe and everything's done in good fashion. I'd like to acknowledge the work of the police department, fire, health, public works, risk management, planning, building services, and the city attorney's office, which are all key members of that special events process and support the review of anywhere from 100 to 150 special event applications on an annual basis. Here's an annual report excerpt that we have. We track attendance that we can actually track at the various facilities that we do offer, as well as our partners. And what I think the key takeaway here is that while this is the stuff that we can track to a reasonable degree of accuracy, obviously the actual use throughout the park system is far greater than the numbers you see on this page, with nearly 3 million people tracked in 2016. One of our core values of the department is collaboration. We're proud of our collaboration with the Great Plains Zoo, Great Bear Recreation Park Incorporated, Dakota Golf Management, among many others that you see on the slide. These public-private partnerships, again, allow us to provide services that otherwise would not be possible. And in total, we partner on some level with more than 70 organizations across the city, whether it be trending sports like lacrosse and pickleball, or our more traditional activities like baseball, football, soccer, tennis, and softball, to name just a few. So our 2018 budget is proposed in front of you here today. You'll notice that it's very similar to 2017's as far as the $18.1 million. And essentially all we've essentially done is shifted money from other operating to personnel to round out our budget. So again, from 17 to 18, our operating budget is flat. This next chart shows the programs, as Jill was just showing in her same presentation, of the different areas that those dollars are tracked in the different programs. I would share with you that, again, the numbers are the same between 17 and 18 at $18.1 million, but there are some variances throughout the different programs, and I'll highlight some of those. The first is in parks and playgrounds. This program is our largest program and involves the greatest number of staff, and as a result, this program increases are associated with wages and benefits. There have been also some slight adjustments in aquatics as well. But before we talked about 2018 proposed budget, I wanted to share where we were at with the Midco Aquatic Center year-to-date in 2017. Through July 31st, we have collected $726,000 in revenue and had expenses of $841,000, with a net loss year-to-date of $115,000. So based on those numbers, we believe we're still on target to end the year at our projected net loss of $500,000 for that facility. So a little more on attendance. Certainly attendance, as you've seen with some of the record attendance we've had month by month in June and then back-to-back in July. It has exceeded our expectations. Looking forward to 2008, we are budgeting for some additional part-time staff to support the increased attendance numbers, which really drive maintenance and lifeguarding needs at the Midco Aquatic Center. One of the ways to know whether the Midco Aquatic Center is going to be busy or not is whether the kids are out of school. That's a huge driver of staffing needs on how much we have to staff up. So when kids are out of school, the place is really busy. And obviously all summer long it's going to be busy too. So we do need to ramp up for that. The good news is that with that increased attendance, we're also projecting offsetting revenues to cover those expense increases. As a result, the support for Midco Aquatic Center for 2018 remains the same at $500,000. And we also wanted to share, since we opened the facility in October of 2016, our numbers are very close to 200,000 attendees in that time. And then through July 31st of 2017 alone, we're at almost 153,000. I'd also just share, and we added the slide at the last minute, but we've had some question about, with all this attendance and these record months that we've had at the Midco Aquatic Center, how is that affecting outdoor pool attendance? And you can see in the blue bars that's the Midco Aquatic Center attendance, and then the gray and the yellow bars really show the 2016 and 2017 outdoor pool attendance. And essentially the answer is it really hasn't affected our outdoor attendance whatsoever. And you'll notice in June that it is down, but the reason for that is that we've had 4 more days where we were closed at all of our facilities. And so if you factored that back in, essentially the attendance would mirror that of 2016 compared to 2017. And you notice in July, they're within 1,000 of each other. So in case you get that question, outdoor attendance remains to be strong. Moving on to outdoor sports, there is a variance due to reducing our projections on the level of support that we need to provide for golf course operations now that the 3 years of construction at Elmwood is completed, which allows all 27 holes to be fully open and available for tee times. I would also mention that we have issued an RFP for golf course management services. Those proposals are due at the end of this month, with the goal of having a golf course management company secured by the end of the year. Ice. Making and keeping ice frozen has been a challenge, needless to say. We've really struggled in order to battle Mother Nature in order to be able to keep good ice. And then the time and effort spent on flooding them, maintaining them, and staffing them is significant when you really look at the number of days that we're actually able to skate. And so we're in the process of evaluating that. We have some consultants on board that are assisting us with an ice rink study to determine the best long-term path forward for ice rinks and warming houses in Sioux Falls. And so this study will help us to analyze and prioritize rink operations across the city. Community centers, the hours have been adjusted as a result of reducing hours of operation at our community centers during times of the day and days of the week where attendance is not as strong as it is at other times. Our takeaways from looking at our attendance is that when in the early fall when we have nice weather and the late spring when we have nice weather, kids want to be outside. And so our attendance is really pretty low during those times of the year. And so we have curtailed back hours at the community centers, but by and large we're maintaining the core part of our community centers. We're just trying to identify those times of the day and days of the weeks and seasons where there are areas where we can curtail those number of hours. The other thing I wanted to share with you is that part of the variance in this particular program is the proposed 25% reduction in the support we provide for the Bowdoin Youth Center, Center for Active Generations, and the YMCA. As I previously mentioned, we've been evaluating our programs and services, and as a result of that evaluation, we are asking these partners to be part of reducing expenditures as well. Our goal in looking at our programs and services across recreation really is not to just blindly reduce services, but rather make the best use of the resources that we have available to us. And sometimes that means reducing or eliminating programs, but sometimes also means creating new ones too and keeping it fresh. Facility maintenance, this is a small item, but we do have one project in there that involves the replacement of the roof at our shop at 49th and Elmwood. Now onto the capital budget. We'll be investing $7.8 million, of which $1 million will go towards equipment replacement program, and the balance to our capital improvement projects of $6.8 million. I would note that it's important to know that 2.1 of that $6.8 million is in the form of private contributions from Friends of the Levitt Shell. And then we also had a private gift that was dedicated for the River Greenway. It was the Bradfield estate that we received, which is restricted for those River Greenway improvements. So we have 2.25 million of that 6.8 that coming from private sources. As we look at capital projects for 2018, Phase 1 of Falls Park West development really will be our signature project. As we look at Falls Park West, we think that once developed, it'll serve as the central park of Sioux Falls, with the Levitt Shell being really that anchor facility in that 13-acre space and really bring it to life in our downtown. Sioux Falls is scheduled to become the 9th city in America to have a dedicated Levitt Shell, made possible by your support as well as the mayor and the Parks and Rec boards, but as well as our private partners, the National Levitt Foundation and the local Friends of Levitt Shell. We'll break ground in the spring of 2018 and likely wrap up the project in early 2019. In addition, we will construct other improvements in addition to the shell, which will be the sloped lawn seating, video board, loading dock and tour bus parking, a new public restroom facility, dedicated ADA seating, landscaping, and site lighting. The Friends of Levitt Shell will also be responsible for providing the sound and lighting equipment. As a reminder, the City of Sioux Falls will own and maintain the shell and the associated development around it. The Friends of Levitt will be responsible for booking and paying for the acts and managing the day-to-day operations of the concert series scheduled to start in 2019. And just as a reminder, we will be scheduling those 50 free events with the Friends of Levitt Shell, but it doesn't mean that it can't be used for other activities. And so if we want to do something else there, the city owns that asset. So outside of those 50 free dates, we'll be able to schedule that and use that. A couple other things that I wanted to highlight and give you a little show and tell are some of our cyclic replacement programs. We have our play structures, our shelters, our park roads and parking lots, trail reconstruction, play court renovations, and park trails and walkways. So let's start with our play structures. Every time we have dollars available, we do a large playground replacement program. It's usually 4 or 5 structures every year. And this year we're working in Tuthill Park, Baker Park, Meldrum Park, and Keene Park. And so those are very close to being completed, and it'll be a lot of fun for the kids to be able to take advantage of that. The nice thing about this program, it brings everything up to the Consumer Product Safety Commission's safety standards, and it also is brought up to speed with any ADA compliance issues as well. Shelters, we have two standard shelters that we install in our parks, 20 by 20 dimension, and then we also have 20 by 40. As you can see, the one on the left, Lion Park, with a complete renovation we did a few years ago, Platinum Valley Park in the southwest part of town, Tower Park on the north edge of downtown, and Galway Park again on the southwest side of town. Park roads and parking lots. I can't remember exactly how many parking spaces we have within the park system, but it's a lot. And I just wanted to give you a couple examples of some before and after pictures of our parking lot work that you see on the left side, and then also some park roads that we have on the right side where we had kind of alligator cracking in both of those particular situations, and ultimately end up with a really good product. This program really involves everything from seal coating and crack sealing, mill and overlays, reconstructions, expansions. Maybe we need 5 or 10 more spaces, or we need additional ADA spaces. We'll incorporate those into those plans, and any drainage or ADA related issues as well. Trail reconstruction, the picture on the left is actually on the levee, but it gives you an indication of the width of the trail and also the condition of the trail before we go in and replace it. The picture on the right is a new section that we just did through the Spencer Tomar Park area. We did half of that project, made it wider, smoother, improved the sight lines, completely ADA accessible. And so after the marathon this fall, we'll finish the other half of that project. But again, it's something that we try to do every year. And then another project is the play court reconstruction. One of the things we did several years ago is we went to post-tension concrete instead of asphalt courts, and it's been a huge thing for our maintenance. The Spellerberg tennis courts is a good example of where we installed the post-tension concrete, and then Riverdale. We converted those courts there to pickleball courts, and that's been hugely popular down at Riverdale. But the key is, a nice thing, it essentially sets us up so all we really have to do is paint the lines and do a color coat versus having to reconstruct courts. And so it's really extend the life of our courts across the city. And then we also have a program for internal park trails and walkways, everything from Arrowhead Park to McKinnon Park to Harmadon to Sherman. There's still a lot of walkways within our park system outside of the trail system as well, and so we have a program for that. A couple other projects of note, the Tut Hill House interior and exterior renovations. I understand there's some siding as part of that project. Try to make some enhancement to that popular venue. We also have the Memorial Park walkways, which will finish out the master plan for Memorial Park. We also have an aquatic facility master plan update in 2018 as well. It's been since 2013 that we did that, so that's in our budget for next year. And then we also have our equipment replacement program that I mentioned earlier. To close, I just wanted to, this is a map we typically give our park board, and I know it's in other city documents as well, where we try to map out where our park improvements are made throughout our 5-year capital plan. And the thing that's not noted on here are the 46 parks that have planned cyclic program improvements. Those cyclic programs I just stepped through with you, there are 46 parks that are not identified on this map that will get improvements as well. So you can see that we're really serving every neighborhood throughout the city. So with that, we would take questions.
Councilor Erpenbach.
Thank you. Thank you, Director Kearney. That's great information. Question for you about that, those cyclic reconstruction programs, especially for the playgrounds. We took some testimony and public input last week, kind of slamming how that works, that it tends to be done more quickly and in more detail in certain neighborhoods and not in others. Can you talk about how that program works, and how do you determine what's the next group of playgrounds you're going to update?
Sure. Well, when we do it, because of the economy of scale, we group those playgrounds together so we can bid them out all at the same time. We use a request for proposal process so that we can really get, a design build process so they can really get a good play value out of it. But then ultimately the same contractor that supplies the equipment will also have his installer come in. And so regardless of what part of the city it is located in, it's going to get installed in the same manner under the same time frame as all the other parks, regardless of the location in the city. And then really, the cyclic programs are really based on age and condition. You know, a general rule of thumb is 20 years, where we start to look at playgrounds for replacement. By that time, there are new, guidelines out for new safety guidelines or whatever it might be. And so, but at the same time, if we have a playground that looks good, it's weathered its 20 years really well. We can push those out farther, but by and large, we really use a 20-year life, and so it's based on age and condition.
So the line item in the budget has been pretty much the same for years and years and years. So can you give us an idea what might a playground cost? You know, and I understand a playground as large as maybe Meldrum Park might be on the high end of the scale, but more of a neighborhood park might be smaller than that. Can you give us kind of that scale? In general, what does a playground cost?
Yeah, it's roughly $100,000 per playground.
Okay. Great. And as Councilor Rolfing says, they've taken all the fun stuff out of the playgrounds because of all the new rules, right? Thank you. I appreciate it.
You bet.
Councilor Neitzer.
Director, two subjects. The first is in terms of programs, and by programs, I'm talking, you know, like things you do in the park that I did when I was a kid, you know, and under the shelters and things like that, or anything else. So as we're looking at the operational budget tightening, are you looking at what factors are you looking at? Are you looking and thinking about if it's a role of the city? Is that one of the things that you're looking at? Is this an appropriate role of the city as with the nonprofits?
Yeah, I think there's a variety of different factors that we've been looking at as we've been evaluating what programs we should offer and how many locations. One, how many people are coming? You know, we've got dedicated staff there. Do we have more staff? Do we have people attending the program? Obviously, that's one of the tests. I think we do want to ask ourselves, is this something that we should remain in the business of doing? One of our general themes is to try to not duplicate services. So if somebody else is already doing it out there, we're going to try to avoid it to the extent that we can. And then it's just value. How much of an investment are we making in this program or service, and how many people are benefiting from it? And so those are the few of the things that we look at. And sometimes, you know, for example, I'll throw out kickball. Kickball was going gangbusters for a very long time, and we had 150 teams when that first rolled out. But now, you know, it's 45, 50 teams, and, you know, people are still benefiting from it. And the nice thing in that case is that the inputs are so low that we essentially provide a field monitor and a kickball, and they're having a great time. And so in those cases, that still makes some sense because we really have very little cost associated with providing that program. So those are some of the things that we look at. Okay,
so that makes sense. Operationally, when it comes to, well, let's just take mowing. Has the policy changed in terms of the mowing in the parks? I have one in mind that I drive by, and obviously something has changed, and I don't know if that's revenue-driven or some other reasoning.
Well, there's two primary things that are driving that. One is the buffer strips along the Big Sioux River. We're trying to improve the water quality of the Big Sioux River, so that's one. If you notice along the bike trail, you notice that we're letting it grow. We're mowing a strip along both sides of the bike trail, but to the extent we can, we're allowing that to grow out naturally. We also have some native grass establishments. If you go out to Legacy Park, for example, you'll notice that that's just beautiful natives out there, but some of it's just what we're calling natural versus natives. But then there's also areas that really are not high-use areas, they're not active-use recreation areas. But for example, around the shelters, we'll keep mowing those areas because that, you know, the foot traffic and long grass really don't, and recreation don't go together. But to the extent we can, if these areas are off to the side and there isn't a functional need to mow them, we're trying to minimize the amount of mowing that we have out there to reduce cost, and obviously got labor and fuel and equipment, and so that really adds up.
So I'll just say it out loud, Sherman Park.
Yep.
Along Kiwanis Avenue. I get the money saving. I also have heard some commentary that what's good for the goose is good for the gander in terms of mowing if it's over 8 inches, and I don't know what I feel about that. I'm conflicted, but
I've had mixed reviews on that particular location. I myself like it, but sure. I would also throw out there is that if folks want to ask for an exemption, we have the ability to do that as long as they meet the criteria and the conditions, and they mow a strip like we mow. They have that option of doing that as well if it's a private property owner or a business. We have several of those that we grant every year, so that if they want to have the native areas, they can do that.
And that is a fair point. I actually had a constituent that had requested one because of his topology, and that was granted, and it was a very challenging area, so that can be granted, and I was appreciative of that.
Yeah, and that's a little bit of what we've got at Sherman too. It's a pretty steep slope there, so it's kind of nice not having to mow it.
Yeah, okay, thanks.
Yes.
Councillor Erpenbach.
I just wanted to follow up on that because sometimes we get questions about this as well. Bugs and weeds, especially in that Sherman Park area. How do you deal with noxious weeds in that area? And then, I mean, we just talked to Jill about mosquito spraying. Are you defeating the purposes of the health department by letting the grass grow?
I'm not a bug expert, but
Come on, jeez.
The thing about noxious weeds, we have the same conditions we put on private property owners that we grant an exemption. We have to follow those same rules. So you cannot have noxious weeds, so thistles, we have to spray those just like anybody else would. And the bug part, I'm not sure about.
Okay.
Good question.
Councillor Staley.
A few questions. Let's go back to the outdoor ice rinks. How many outdoor ice rinks are there?
6.
So you said these are very challenging now in the wintertime? Did I hear that right?
Some more than others.
What makes that happen?
Well, Tut Hill, for example, is our best one, but it has the most shade. And so it's a very pretty stable rink compared to all the other ones. And so when it does have the shade, obviously it resists melting, and so it's a lot better situation there than maybe some of the others that don't have the shade.
So for a few things about the consultant. What kind of a cost factor are you thinking that you're going to be paying this consultant?
I could get back to you on that.
Talking generally, I'm sure you've done them before. They'd be more than $50,000?
No, I don't think it's more than 50,000. But I don't want to quote you because I don't know.
So
off the top of my
the
head.
purpose of the consultant is going to be to what? Say we're going to continue to have these ice rinks. Maybe we would eliminate some of them.
It's to really analyze our existing operations, the conditions of our existing rinks and our warming houses, and make recommendations on what we should do for the future provision of ice skating in Sioux Falls. What are the different options that we could potentially pursue? Because obviously, the way we're currently doing it, we had 5,500 the last 2 seasons of use at those rinks across 6 rinks. And so what we're trying to decide is there a better way to provide ice for our community versus what we're currently doing?
And do we have any way of knowing how many neighborhood kids are actually using these ice rinks?
We do. We do when the warming houses are open. We actually track attendance. But if they're using them after the warming, or before or after the warming houses are open, that we don't know.
Okay. So, and when are you planning on doing this study?
We're currently in the process of doing it right now.
The next thing, I just wanted to say this for the public. Last week, you and I asked you for some information about subsidies for the outdoor pools, just to get that number out there. You said about $1.5 million.
Correct.
We budget. Okay, good. And then the last thing I wanted to say is, when we're talking about swim meets, what is the amount of money that an individual, a child, will pay for a weekend to participate at the Midco Aquatic Center for a swim meet?
The city council set that rate at $10 per participant.
For the whole week?
For each meet, whether it's one-day
weekend.
meet or a 3-day meet, it's $10.
Okay, thank you.
You bet.
Councillor Selberg.
Thank you, Mr. Chairman. Thank you, Director. Quick question. There's been a lot of talk and questions about Great Life and the golf program and them putting in a proposal. Do we generally see a number of proposals as far as the golf operation every year? This will be the first time we've done an RFP for golf course operations in quite some time. Dakota Golf has had it for quite some time, but I can tell you that we've had very strong interest in people interested in proposing on the golf course RFP that we have for golf course management services. So it hasn't been open in the past just because there hasn't been interest or inquiries about it, or?
Most of the time, it's just been renewed over the years, and we actually talked about doing it, an RFP 4 or 5 years ago. Yeah, probably 4 or 5 years ago. But at that time, we were in the middle of this Elmwood renovation. And so we wanted to get through that Elmwood renovation before we did the RFP. And now that that's over, therefore the timing of issuing the RFP to see what other proposals we might get for golf course management services.
So now that it's open, has there been any talk of you think you'll see more than just Great Life coming forward?
Oh, yeah. Again, we've received strong interest from not only local firms, but national firms.
Oh, okay.
Yeah,
Thank you.
you bet.
Councilor Starr?
Thank you, Mr. Chairman. Director, two things, I guess, on two different areas. One, I wanted to talk a little bit more about the Canary Stadium and the improvement. Do you see maybe in your judgment that the location and the stadium is a long-term best interest for the city? Or at some point, do we need to be maybe possibly looking at another location for the Canary Stadium? I guess my concern where I'm headed, and I did a little bit of this last year as well when we did the engineering and stuff that we did in 17. Either I think we need to make a commitment to the stadium where at its location and and invest in it and make it the best stadium possible for our citizens and our users, or we need to head down the path of maybe looking in a different location. What concerns me is when we spend hundreds of thousands of dollars doing repairs without a long-term vision. I think Director Turbach had the right idea with the arena, that we're kind of backing up a little bit before we make major investments in the arena. What's the long-term use? What are we looking at as a city? So to simplify my babbling, do you see this as a long-term location and a continued place for a municipal baseball facility, or is this something that we're at a point where we really need to take a look and say, where is the best place in the community and what is the long-term use for the facility?
I was involved in, we were involved in that assessment of the stadium, and the architects have indicated that with improvements that Tracy had mentioned earlier, and phasing in those improvements, that it'll essentially restart the clock, to take the words out of his mouth, with the stadium to extend the life of it. And so I see that as, at least the architect's opinion is that it does have some significant useful life if we continue to invest in some of the recommendations they had.
Makes sense. And then if I can, Mr. Chair, to follow up maybe a little bit on Councilor Selberg's point, I went back and I've been taking a look at the recommendations in the report that National Golf Foundation Consulting did for us. And really they set out two real objectives of kind of as a path forward, staying real autonomous, where we as a city are responsible for the golf course and the capital improvements, versus maybe something that is a little bit of a change for the community and the thought process, because we're beginning to get those emails of save our facilities, and I think all of the council have got those. Have we made that policy decision that where we're headed to continue to stay in that more autonomous model and we be responsible as a city, or turning it over more to that vendor, whoever that vendor comes forward as part of the RFP process?
Well, I think I have a two-part answer for you. One, the way we set up the RFP is to provide what we think is maximum flexibility, so that the proposers can submit a management fee option or a lease option, and that's the way it's currently structured. So, I believe they can actually submit both, so that they have ultimate flexibility. So we have lots of different options to review from the different proposers. But I would tell you that the current arrangement we've had with Dakota Golf is very much a turnkey operation. They provide all the staff, they provide all the equipment, they essentially run everything: the visitor, or the clubhouse, the pro shop, the lessons, the merchandise. Really, we really have very little involvement in the operations of our courses now, and certainly that's the way this is set up to be. We fully expect whoever is the successful proposer on the RFP would do that in the future as well.
Okay. Well, as the consultant pointed out, we have, at least since 2013, made a significant investment to make the vendor whole and provide a profit margin for them as well, which makes sense. I mean, that's a good partnership with a vendor. But it looks like, at least in their recommendations, that we make some pretty significant capital investments if we go that direction. So I'll be interested in following the process and the policy decision.
Yep, thank you for that. And I forgot, we did do a slight change through this renovation process, so we did guarantee them net income as part of that. But yeah, it should be interesting to see. I can tell you that we have very strong interest from national and local firms in that.
Thank you.
You bet.
Councilor Rolfing.
Yeah, just wanted to comment on Councilor's observation there. One is, I think the part of the agreement we have with the go to management now is that a certain amount of the green fees, whatever, is set aside and for capital improvement. So literally, it's not coming out of the general fund. It's kind of almost an enterprise fund. Not quite, but somewhat similar to that, so that when the capital is needed to improve the golf courses, it comes from the golfers. It's a user fee more than it is something that the whole city is paying for. Am I not correct?
Yeah, up until the renovation started at Elmwood, there were 20% that was of gross that was taken and placed in a fund. 10% was allowed to be used for golf course improvements, and at the time it was about $250,000 a year that could be reinvested in the courses, and the other $250,000 on average, I'm generalizing, but that would come back to the city into the city's general fund.
Okay, thank you.
You bet.
Any other questions for the director? Director Kearney, nearly 2.9 million attendees in our parks and recreation programs, and my guess is that would maybe double if we could count somehow the other aspects of the parks and their usage that basically are uncountable. Such as our bike trails and the parks when there isn't a program in operation or a shelter being rented. So I know growing up that I greatly appreciated our parks and rec system, especially growing up in a family that had fairly modest income and other demands within our family. Just one comment about the no-mow policy in some of the parks. I ran into a citizen just this morning that was very complimentary on the mow zone and saw the value in that, not only in a budget saving, but an environmental conserving as an environmental conservation practice. So I think there are many members of the city that are appreciative of that policy. So thank you very much,
you bet.
Director,
Thank you
for your presentation. Okay, our next presentation will be by Director of Public Works, Mark Cotter, on the Public Works portion of our budget. And Director Cotter, we have just finished up 47 slides. The next 49 are all yours.
Thank you.
You're
for
welcome.
Framing that up.
I will add that it's appropriate since the majority of our budget is concentrated next year in your area.
Well, thank you for having us. And the Public Works Management team is here, and we're here to deliver a sound budget. We also have our financial analyst here, Shauna Nelson. And so as we walk through the budget, we've got a lot of ground to cover, but we hope that our presentation sort of preempts and answers your questions and those that are watching. Public Works team is 10 divisions. It has 270 full-time employees. At any given time of the year, we have about 60 part-time employees to get the public's work done. All right, let's get started. So this year's budget for our general fund divisions and enterprise is a budget of $178.7 million. Our priority is managing the transportation system and the public's utilities. I know you and our customers expect us to be forward-focused, maximize technology, and never get behind. And those areas of focus is something that we take to heart every single day. All right, let's start with highways and streets. These are general fund divisions within Public Works, and they involve the engineering, street, and storm drainage divisions within Public Works. There's a nominal increase in budget when you look across and sum these three areas up of about $3.7 million comparing it to the 2017 and 2018 budgets. We'll dive down a little bit deeper in this now, breaking it down with engineering. Engineering really focuses on not only the core of the existing city, but as we expand the roads to make sure that the work that we do meets the engineering design standards, efficiently planning, constructing, and maintaining the public's infrastructure. And then yesterday we were able to highlight with Heath Hoff-Teaser, our principal traffic engineer, the new adaptive system that will go into Minnesota Avenue. And I know that they've been working this morning, starting about mid-morning, starting to convert the current progressions on Minnesota Avenue to adaptive. And so I know Heath expects to try to work out most of those issues by Wednesday, so hopefully we'll see smoother travel on Minnesota Avenue, and in about a month we'll turn on the 41st Street system. All right, engineering's budget, very minor changes when you compare it from 2017 to 2018. We've got some normal wage and benefit allocations. The mayor did ask us if additional dollars become available in general fund, where would we spend those? And of all three divisions, we got behind more investment into traffic. The brains of the traffic system, if you will, the controllers, many of those get new generations that come out, and then very soon they're not supported, and so we want to make sure that we have good traffic controllers running the signals. The battery backup systems on those key intersections are important to make sure that we not only install them but maintain them. And then vehicle detection repairs. Last budget we talked about, and this council amended in driver feedback signs. There were 2 pairs that were added to the budget, and we did install those. We've got some initial feedback for you. The first ones that we installed on South Cliff Avenue, just I think from the environment and the fact that it's a 4-lane road, we just didn't see the speed reductions that we'd hoped to see on Cliff Avenue. And I think one of the things that was just south of 229, it's a challenge to see some of the value in those on 4-lane roads. We see a lot better awareness on 2-lane roads, and especially in front of school zones. It's more of that, as Heath would say, it kind of shames you to slow down as you go through a school zone. But on some of the environments that drivers face on South Cliff Avenue, we just didn't see the value there. We did move it to 8th Street recently and seen a significant drop in speed, I think almost 11 to 12%. That will likely get converted over to a permanent sign. In this budget, we've got planned for 3 additional pairs, and so 6 new driver feedback signs that Heath will work with the PD to place in the next 3 high priority areas. The reason they come in pairs is so you can either put one on northbound and southbound or eastbound and westbound. Okay. Snow removal. Snow removal is very near and dear to everyone in this community, and we've geared up to not only deliver that in a very efficient manner with the right people, the right machines, but also leveraging local contractors. This last season, we had about 6 snow events, 2 of which we plowed out in about 19 hours. That's some of the fastest we've ever done so. Some of the reasons for that is when we started to implement snow gates, initially we had some contractors locally that were concerned about putting them on their machines. It was new to them. Some of their machines, it didn't really fit. Since then, they've come back. One of the things we did to try to counter that is we rented an additional 8 motor graders, and they have really allowed us to kind of keep that sweet spot in that time that we'd like to have in about 24 hours clearing out the city. We are, with this budget, going to not renew a contract with a vendor for 8 of those motor graders. And part of that is the vendor has to agree to extend that contract. They bid it very competitively. We're not willing to extend that. We also feel very comfortable on the progression that we get through the city, and we've got good contractor involvement that we don't expect that to affect our performance. Just for your insight, when we rent a motor grader, it usually costs us about $20,000 a season for one motor grader to be rented. All right, snow removal operations, again, just very little in the way of budget change between 2017 and 2018. 18, the big probably driver here is us reconciling the right amount of part-time staff to utilize to do the work. We'll be adjusting our part-time staff down about 3 more, down to about 25 from 28, and so that's where you see that reconciliation on the personnel. Street maintenance, this really the key function of street maintenance is to maximize street life, and with a number of different activities, street sweeping, pothole patching, also that comes out of street maintenance is street light repair. And so this budget frames up to maximize our street life, but also provide a good commuting routes for the traveling public. Street maintenance budgets on page 45, you'll see that that's been reduced by about $200,000. Much of the change on personnel, again, is just an allocation decrease. As we continue to have more years with the new financial software, allows us to make sure we either reconcile the right amount of personnel time in street maintenance or snow removal, so that's that change. And then the other driver in operating is we were planning to redrive the city in 18 with the high-tech van to give us a perspective on our street condition. Based on budget and based on our data, we feel like we can extend that out 1 more year, so we've moved that IMS study to 19. And that's really the key drivers in that budget change. Highways and streets, everyone's recognized the new projections on sales tax, and we've looked at each program that we have. These are the key 7 programs where we allocate the funds, the sales tax funds, to make sure we can maximize infrastructure life. And we'll take you through each of those respective areas. One of the drivers in this program is the asphalt, street rehabilitation, maintenance, and reconstruction, and concrete pavement. The driver on making the investment that we do is that we can keep our pavement condition index at a high level to make sure that our streets life is maximized. We felt very good when the IMS data came back that a number of peer cities across the country, that their condition index of their streets ranged between 60 and 65. The City of Sioux Falls ranged at 70. I think that's been a reflection on the council. This council, prior councils, certainly endorsing investment in street maintenance. The other factor is really having the street team and the engineering team identify. We typically make an improvement to about 800 blocks of streets a year based on various treatments, and it's important that they're selecting the right treatment for the right streets at the right time to achieve a 70. So they've done a good job, and I recognize them for that. All right, we also get asked, well, why aren't you focusing on the worst streets? And so this is a map of the 40 segments in town based on the last survey that scored a 25 or lower. And I will tell you that our plan is to positively affect those 40 segments by the end of 2019, much of which has already been addressed. But also know that one block of street, could be a street that you live on, has one, what we call a frost boil. Could be something about the size of this area in the room that breaks up. Just having the van go across that one frost boil could reduce that block of street down to below a 25. And so we advance a lot of frost boil repair contract work. We do it ourselves as well, but things like that can reduce it. And so that's why a number of those that are somewhat scattered throughout the city, they're isolated situations, but our intent is to capture them all by the end of 2019. The street system it's exposed to snow, wind, rain, sun. Sun is one of the hardest things on asphalt pavement as it gets oxidized, and so just know that as we move through this space and time, we've got other streets that are also getting oxidized and reducing, and so that's why it'll be very important for us to redrive the city in 19 so we can get a new baseline of where we're at. All right, we've talked a lot about good, safe, accessible crosswalks. We've made this community's made a substantial investment into removing barriers. Here's two different pictures of barriers that are faced in neighborhoods. The one on the left is really a barrier, but the street is in very good shape. We really try hard to sync up when we improve a street, and then we upgrade and remove the barriers. In some of these cases, we recognize that there was a number of them that the street was not needed to be invested in for several more years. So we went in, captured, and removed all those barriers, completed that work in 2016. The other, we continue to work through the system. We're very proud of the investment that the community has made, and now we're down to less than 1% of intersection corners still have sidewalk barriers in the city. Most cities would not be able to talk to that. And so it's a big feather. We also recognize in this capital plan that there's much more work to be done. And so we've taken that investment in this new capital plan up to $2.5 million over the 5-year period of time. All right, we do want to frame up and share with you where the major investments will be happening in 2018. And so that's the list of projects, but we, to keep it more interesting, we have maps for you, and we'll take you through each one of those. The TLS Road will be the flagship project for 2018. It will be nearly 2 miles in length. I understand Councilor Neitzert had looked at some of the typical sections and the geometrics of the design. We're just getting to that point where we're ready to go to the public and really get some feedback on the typical section that's been selected, and just work through all those individual unique issues, whether it be drainage, access, sidewalk connectivity, things of that nature. That work will now begin. But this starts at 41st Street and goes as far north to where there's some existing concrete that exists as it goes into the 12th Street intersection. 85th Street, starting at Louise and then heading due west. We are designing this full mile because of all the work that we're doing with the development near 85th Street and I-29. Financially, we'll be able to afford this and do this in phases. And so our goal in 2018 will be to go from Louise Avenue and get through Hughes Avenue intersection. If funds become available, we'll have the design to potentially go another quarter mile further to the west. All right, this is Madison Street. This is a great road that gets you from the interstate all the way into the West Avenue area. We're going to focus some dollars in this intersection of Louise and Madison. This section of Madison is this pavement's very much deteriorated. One of the limitations with Madison today is that if you drive out there, the bridge that's over the Big Sioux River has some concrete barriers that are set out into those lanes that provide a safe passage for pedestrians. We want to be able to remove those barriers so we can have 2 lanes of traffic in each direction. And to do that, we'll build a new pedestrian bridge offline to make a safe crossing for that. Arrowhead Parkway, we've been talking about this project for some time. It took extensive right-of-way negotiation this year. This project did just get bid to a local contractor, just under $9 million. And we'll start this year with really the reconstruction of Highland Avenue intersection, and then it will be completed next year. Main Avenue roadway diet. We hope to complete that this year. Financially, we're not able to, so we'll wrap that section up between 6th Street and 8th Street next year. And then the last phase of Veterans Parkway that the governor committed to get us connected to I-90 will be bid in September. It's an extensive project. It's got an initial project estimate of about $62 million. And so you'll see an extensive amount of construction. There's 5 structures on it, extensive bridge work, new interchange on I-90. Really modernizes the regional corridor system that we have in the east side of the city of Sioux Falls. All right, this is outside of our area, but it'll be a significant investment that the state will make from 85th in Minnesota due south 3 miles. That'll be converting a 2-lane rural section road to a 4-lane urban road. Give great regional corridor for Harrisburg, Worthing, people that travel into town from northwest Iowa, and T. All right, this is a picture of Rotary Park, or just essentially west of Rotary Park. Before we can start the work at 26th Street and Southeastern, we have to remove the majority of the Rotary Park elements from the east side of the river to the west side of the river. Once we get done, there will be no vehicle traffic or access to where Rotary Park exists today to be able to accomplish the needs of the transportation project. So you'll see that work happen next year. And then railroad relocation, we'll be able to take full possession of the yard after November of 2017. We'll begin to design the project later this year that will remove the tracks, restore pavement in 6th and 8th Street, there's a freight house that'll get removed, and then also build a fence along the east property line. All that work will start to happen in early 2018 to prepare that ground for redevelopment. All right, and the 8th Street Bridge, we just wanted to bring you up to speed on the work that we've been doing with the 8th Street Bridge. It's a significant piece of infrastructure that's right in our downtown. It was commissioned back in 1912. It was the first key crossing for the city of Sioux Falls across the river. And one of the things we were interested in is are we able to rehabilitate it, or are we going to have to replace it? To rehabilitate it and get another serviceable life of maybe 30 years out without minimal maintenance, but really trying to get another design life of 75 years out. We brought in a team of experts and contractors. They took a series of cores of the existing concrete, sent them off to Minneapolis, had them analyzed. We do have just a piece of some of the re-steel that you guys can see afterwards. It's still, after 100 years, in very good condition, very little corrosion that's happened in the majority of that structure. And so we're going to complete the evaluation here by the end of summer and be able to make a final recommendation to you. But I really think the goal is that if a replacement option is about $12.5 million, to rehabilitate it is usually about a third to half of that. So it'll be a big win for, I think, the community if we can save it and also get another 75 years of life out of it. So more to come on the 8th Street Bridge. All right, storm drainage. Storm drainage is very important, very personal utility to many. And so we want you to know that there's going to be significant investments made in our storm drainage system throughout the city. We've listed the budget page for you. For the operating budget, there's a very minor amount of changes. Some of that is just, again, reallocations as we take out things like the first sweeping, when we go into a drainage way and we remove silt. Again, it's just getting more history with this utility so we can get the personnel dollars correctly. And then we've made some changes in professional services and moved some of those dollars to our capital side. All right, the picture that shows is very typical, is that as drainage systems need to be maintained, you've got to be actively removing the silt in them based on the amount of water that they manage. We've got two real significant drainage improvement projects that'll be on the west side of the city. Probably the largest one is Terry Avenue and 43rd Street. At one time, we conceived to actually do that in a couple phases, with financing that through low interest loans through the state. It'll be our recommendation to do it in one. We're doing a number of drainage improvements. A non-point source is working north of the city to try to improve the water quality from a sedimentation and bacteria standpoint. And then also starting to fund more regional stormwater analysis. We've had, say on the east side, there'll be 3 large developments that are going in all at the same time that may have one large detention pond. We'll do a third-party review with that, with a project like the regional stormwater, have all 3 of those developments send us their design files, and then run one dynamic model to make sure everything is sized appropriately. So we're starting to fund that more and more as these developments get larger and larger. All right, electric light. Electric light's very well run, and it's got a good budget to position it for the future. This is a utility that is free of debt and in the current capital plan stays such. There's 2,700 customers that rely on electricity from this utility every day, and there's 19,400 streetlights. There's a personnel budget is $1.6 million. The majority of this budget is operating, which is essentially us buying power from WAPA and Heartland and then reselling it to our customers. Capital, the operational changes that you'll see are very minor in nature. About that number on the 2018 should actually be 8.1. So we've just got about a $200,000 change in this utility, and just a slight change in personnel, and then we've got a slight change in repair and maintenance. Capital side, continue to make investments. These are assets that normally are generally out in the elements, and so they wear out over time. The circuit improvements, the above ground power, some of these assets have been in service for 30, 40, and 50 years, so we continually evaluate them and update those circuits. We did want to highlight that the tunnel project that just recently got done, that the tunnel for the last number of years has operated with 284 400-watt high-pressure sodium lights. Jerry Jongling and his team did an evaluation with new LED technologies that came on. We could go down from 284 fixtures down to 180 and then ultimately save about $49,000 a year in electricity costs and maintenance. And so with the total project at $345,000, we expect the ROI to be just under 7 years. So that work is done. As you drive through the tunnel, it's a nice, clean, white, refreshing light. We are, in 2018, we'll start the design of the new substation over by Concrete Materials on Madison Avenue, and then begin those constructions of that substation in 19 and 20. All right, landfill is also a utility that's very well run. It's free of debt and is well positioned for growth. Landfill and water reclamation both this year have done 25-year look-forward master plans. We'll wrap up the landfill one toward the end of the year, and I think it would be a good topic to bring it before you and share with you what the work produced. Just to essentially frame this up, our job is to make sure for the entire 5-county area that we've got enough airspace to look forward and bury the MSW and C&D for today and into the future. We've got a heavy focus on sustainability and recycling, and we just mentioned that the solid waste master plan will be completed in 2017. We just have a couple of pictures for you to show you some of the technology that the landfill uses to make sure that it has at any given time a good sense of how many years are left in the landfill. So the picture on the left-hand side, that's essentially a surface. So just think about it as a surface, and it's somewhat undulating. And if you went out there today, when you develop a landfill cell, the last one we did was about 20 acres in size and about 80 feet deep. And so you not only start to fill from about 80 feet below the normal ground surface, but then we can get upwards of 120 feet above ground. And so that just shows you at any given time where the working face is, what that surface is, and also what our compaction rates are. And then if you compare that to what the ultimate surface will be on the right-hand side, you can extrapolate how many years forward of airspace we have. Today we have about 60 years of airspace available at the landfill for the 5-county area. Some of the tools that we're fortunate to have and some of the operational changes that Dustin and the landfill team have made is we used to use 2 of these compactors working hand in hand. Now we use a dozer and one of these landfill compactors. This is a screenshot of what the operators have inside. And just with technology and trying to use color codes, if you end up seeing green, so in that upper left-hand corner, the tracks, you can kind of see the sketch of the compactor that's drawn on top. The green areas, that means that it's been compacted enough. There's technology in these machines that can give us a sense of how compact that waste is. If it's red, it'll say you need to go over it at least 2 more passes, and if it's blue, you need at least 1 more pass. So it really gives some good immediate feedback to the operators. When we were measuring compaction about 10, 12 years ago, we were getting about 800 to 900 pounds per cubic yard. Now we're well above the industry average, and we're about 1,350 pounds per cubic yard. Everything about landfills is airspace. The more you can compact in one area makes you much more efficient, makes that landfill space get extended. All right, sanitary landfill, again, very nominal changes that we'll see in this budget, about $300,000, normal wage and benefit changes, and then we do have some additional professional services that we're right-sizing some of the contracts at the electronic household hazardous waste. We've seen some of our pricing go up from our vendor, and then also leachate disposal. We've got a good long-term plan to actually reduce those leachate costs. Leachate's essentially rainwater, natural moisture that is inside the waste that as it filters through picks up contaminants, and our practice has been that truck that's on the left-hand side, we load that out and then ultimately truck it down to the street division where we have a good spot to dump it. In our capital plan, the landfill team has evaluated building a lift station at the landfill and actually pumping it to Sioux Falls, and we'll just dump it into the collection system, save us on trucking, and also be able to handle the different swings of the year with leachate. Anytime you operate a modern landfill, you've got to be constantly installing leachate collection and landfill gas infrastructure. We're also going to start the design in 2018 to install the force main to the city. Land acquisition is always a factor around a landfill to make sure you have enough room to grow, but also adequate buffers. So we're typically always in the market if there's available land near the landfill. And then we're making some improvements to the public drop-off area with some additional asphalt paving. All right, let's go into water. So the water team, also very well run between water and wastewater. We have about 55,000 customers that depend on clean, fresh drinking water every day. I think it's worth noting that the city back in the early 90s was one of the first supporters of Lewis and Clark, and we've enjoyed being connected to the Missouri River, not only for our near-term needs but for our long-term needs. So I think that's just it's a feather in this council and this the forward-looking that happens with utilities. You just can't get behind in water or wastewater services. It's very hard to get back on track. The other notable item with water, and some of these things happen over time, but I don't want you to forget them if your customers ask you, is that in the early 2000s, this community really started to invest in water conservation, changing out those 3, 5, 7-gallon toilets. This community has spent about $3.2 million on rebates, and the result of just over a decade later is we've saved over 3 million gallons of water per day. And if you run that out for an entire year, that saves us almost 1.1 billion gallons of water that we don't have to harvest, treat, and distribute on an annual basis. The compounding benefit of funding conservation is also all that water doesn't have to go through the wastewater plant. So collectively, our sources are maintained for a much longer period of time. Our rates can be more competitive, but also it is the right thing to do. It's more sustainable. And last, our customers' bills are lower because of it. This year, the team will have completed all the lead service renewals. And so with some of the national stories that happened last year and some cities that have tens and 20,000 lead services to get removed, there was a major effort to identify where the remaining ones were in Sioux Falls. The majority of them got done last year, and we'll complete those this year. So that's a huge feather. Recently, I know we've talked about backflow prevention, and I've communicated with you that we've got a really good plan moving forward for new installations, but we will get a good stakeholder group together and really help us with some of the retrofit challenges so we can re-baseline some of those discussions going forward. All right, let's get started. So water's got some change about $800,000. One of the real drivers, there's a minor change in normal wages and benefits, as you guys have seen. One of the drivers, it's time to repaint the tower over at Keene Park. That's driving that. We expect to buy a little bit more water from Lewis and Clark, and then also our chemicals that we buy to treat the water are also expected to go up, and so we've budgeted accordingly for that. All right, the water capital. We have not taken on additional debt in this utility for a number of years, and in our current strategy, we don't intend to. We did want to share with you that, so the capital work that will happen next year, the $12.4 million, that will be user fee driven. And then we did put a picture on the right-hand side. All those lines that are on the map, especially most of those are in the core part of the city. Those are areas that we see mains have aged. We start to see a break history that then we work hard to coordinate that with a street improvement project so we can minimize the disruption in water service to those customers and make sure we have a good new 100-year pipe in the ground. All right, and our last utility to talk about today is water reclamation. Always our goal is to provide uninterrupted regional wastewater service. We've had really good discussions with communities in the region, and we'll continue to as we can harness the economies of scale and the environmental benefits of regionalization to continue to press forward. Highlight that just happened today. We've been managing a risk to tunnel under 229 to advance the new 72-inch outfall pipe. The tunnel itself is 96 inches in diameter. They just made it from one end to the other today, so it's big relief for us that live in this world. And so we started off really rocky by hitting several boulders and ultimately not knowing if we could actually do the tunnel across 229. We made it. We don't have to have any disruptions to traffic, so home run for this community. All right, let's some very minor changes that are reflected in the personnel and operating for this utility on an operating side. And then the capital side, we've got, this is the second master plan that we've done this year, and we'll start to wrap that up. We're just now starting to see the drafts. You know, this utility today has an average flow of about 18.2 million gallons a day, and we are rated for 21. So we are nearing our capacity, and so that's really what drove us to write a master plan so we can look forward 25 years. One of the exercises that we did this time was with that same maturity rate, we asked the consultant to model us out. What size will the community be in 50 years and then 100 years? Really, the exercise we did that for is so we can start to size and identify where our big trunk mains will be for that period of time. The key capital investments that you'll see next year is the clarifier, the final clarifier on the campus, and then the main pump station design will really start to get ramped up. The main pump station will ultimately get replaced in 2019. All right, Council, that's our budget. We covered a lot of ground. The team is here. We hope to answer your questions. Thank you.
Thank you, Director Connor. Questions, Councilor Neitzer.
Director, in terms of the electronics recycling, that I think the cost continues to go up for that. Has there been any consideration, and some people may fall over when I propose this, of charging people a fee and rather than doing it for free? I mean, you charge me maybe $10. It's still quite a steal to get rid of an old TV or something. Now, I would assume if you charge too much, it may incentivize people to stick it in the garbage and put a garbage bag over it. But at some point, you know, is it something that we need to look at? I don't know how much this is in the grand scheme of things, but
I would say near term we don't need to charge for that service. You know, we already have we enjoy very competitive rates at the landfill compared to most in the region. We don't have a proposed rate increase right now, even in the landfill. And I agree with what you say. If you start to charge for some of those things, we're going to lose the benefit of keeping them out of the landfill. I think the recognition that we had this last year with the new contract was we've been paying extremely competitive rates on the recycling of electronics. And I think it was just anytime you go through a correction, you go, wow, we're paying a lot more. But in respect to what others in the country are paying, that's what we had to do before we moved through with the contract, is that we still feel like it's a great service. Our customers love it, and we feel like there's a strong environmental benefit. So I would not recommend us charging at this point in time.
And
Continue.
one other question. Do we know how much that we reimburse to developers for the sump pump collection systems? I'm not talking about the retrofits. I mean in the new neighborhoods in a given year.
Sure. Andy, is that something you can get, or if not, we can follow up?
Andy Berg, Public Works. It fluctuates with the development intensity. In the slower years, it's about 100,000, and in the heavy years, it goes up to about 200,000. So the total budget is 300,000. Whatever doesn't go towards reimbursements goes towards the retrofit program.
Okay, and the thing that I've struggled with since I got on the council is, so we are reimbursing $100,000, $200,000 a year for these, but then we're not requiring people to connect to them. So we have all of this infrastructure we're putting in the ground, and I understand it's going to be a little bit more money on the cost of housing, and I know, the HBA is not going to be thrilled about that idea. But that being said, if we're investing that much money, and in my neighborhood, I have, I think, one that I know of on the whole block, or 2 blocks, that is connected. And so it just seems odd to me that we would reimburse that much year after year and have idle infrastructure sitting there.
Sure. Yeah, that is something that we are, Lance Weatherly, the principal drainage engineer, and all of us in Public Works are looking at bringing that forward again. We've had discussions with you and others about that, going to possibly mandatory connections. We certainly feel it's a great asset, and we would love to see more people use it. We do have the ability to force connection to it if someone is a nuisance pumper, but yeah, currently that is the only method we have to force it.
Well, and we both know that on the front end, when you're building the house, it's a heck of a lot easier than when you have the sprinkler system in, you've got the lawn, you've got all that. And the other argument that people will give is, well, I'm not pumping, but sometimes the water table changes, a building happens. Just because I don't pump today doesn't mean I'm not going to pump in a couple of years.
Absolutely.
So I think we really need to look at that, especially that is a lot of money that we're putting in or reimbursing for infrastructure. We ought to be using it.
Yep.
So.
Before I go to Councilor Staley, just a brief comment on that. As you both know, I've expressed the same concern the past 3 years while being on the council regarding that, and I have worked with you as well as with IRAB to move that forward, and I, like Councilor Neitzer, share the same concerns and desires to move that forward. Councilor Staley?
Okay, thank you. Mark, first of all, I appreciate your presentation. Fabulous job.
Thank you.
Thank you for all you do for our city. And I especially thank you for the responsiveness you give to us when we reach out to you. Bravo. Okay, I just wanted to go back. You were talking about cutting back on contractors for snow removal. Did I hear that right?
No, not contractors, the machines that we rent. And so we rented an additional 8 because when we were transitioning into snow gates, we were losing about 8 contractors at the time. And since then, they've seen that their concerns have gone away from an operation standpoint. So we've gained some contractors.
Yes.
And then we just recognize that there's a tangible limit. If you drive by the street campus, that's a lot of motor graders that are sitting unless we're plowing out a street. And so we go, okay, what's a tangible time frame? When we got it down to 19 hours, 2 out of the 6 times, we thought this is a reasonable risk for us to manage. And that's why we did not pursue going back with that vendor.
Okay. Then the other, okay, I've got a few things here. The 229 26th Street cut off, I thought they were going to reconfigure that. Someone asked me what happened to that whole project, because we were talking about houses over by my area being sold off. Is that kind of been put on hold?
Oh, no. That's, so I shared that next year we start to move Rotary Park from the east side of the river to the west.
Right.
And then we'll line up an access with them with Cliff Avenue Greenhouse. And then the major renovations for Exit 5 on 229, which is 26th Street, and the raising of 26th and Southeastern all begins in 19 and 20.
So are we going to be, is someone going to be buying those houses on the back end?
No.
Well, I thought some of them, those people were going to have to move out that would be, have their backyards right up against the interstate now.
So we've done a number of public meetings. I think there's only one more house to purchase, and we're under active discussions with them, with the DOT, and I think it's going to be a really good solution.
Okay. Then we were talking, you're calling them feedback signs. I'm calling them solar speed signs. We're talking about the same signs, correct?
Right. Heath coaches me, calls them driver feedback
Driver
signs.
feedback. Okay, solar, I call them the solar speed signs. Anyway, I did get some, I have heard from people that commented on how effective they were on Cliff Avenue. And we were at, Councilor Erpenbach and I and Councilor Neisert were at a meeting yesterday. We were talking about the possibility of putting those in some of these other areas downtown. But the residents there said that they're most effective, and I would agree, if you have the actual sign of how fast you're supposed to go on top of it. So they're not effective if you just show us how fast we're going. You have to let us know what the speed limit is, okay?
Okay.
And the other thing that came up in this discussion is that we need more signs out just to tell people how fast the speed limit is in a certain area, because we have these transitional changes within short periods of road that we need to do. Also, you're talking, I remember last year we were going over that survey of the guys in the van, and I remember saying we needed to do worst first, and they said no. And then the mayor said in his budget address a few weeks ago, worst first. So we're going worst first. I think that's wonderful. It sounds like by 2019, we're going to be able to say to our people and people coming to Sioux Falls, we don't have any very poor streets left. We're going to be taking care of those. Am I hearing that right?
The 40 streets that scored under a 25, they'll all be addressed by the end of 2019.
Very poor, the very poor ones.
The very poor ones. In general, though, that's only 40 segments, okay? So we affect about 800 blocks a year, and we would not take the worst first approach. We would always take, as you look at a pavement condition curve, that as it starts to drop off, that's when you need to do a slurry seal or a mill and overlay. And so I wanted to give you a perspective that we're still, the only way to keep that, our overall condition index at a 70, we have to put the right treatments on at the right time. And if we were to, just the strategy that we've always said is like a slurry seal, or I think what we used to call it is a microsurface, that costs about $3,000 a block. To reconstruct a block costs about $100,000. So it's much better use of taxpayer dollars to go in there and affect 33 blocks than to put all our eggs in one block, okay? So that's why we want to make sure people know that if your street score is low, we're going to be there, but we're going to work it into the system. If I took all the asphalt rehabilitation dollars that the council gave Public Works and went to the worst, we'd probably go from 800 blocks that we're affecting down to 50.
What percentage you said, if we're talking about the very poorest streets, I was thinking it was like 4% of the total. Is that right from last year?
That's what it scored, and I think the intention they said is a healthy street system would be to be less than 12%, and ours was at 4%.
For the worst.
Yeah.
Yeah, I just remember the mayor saying we're going to take on worst first.
Well, I know we've talked about that we're going to make sure that we have the worst streets that scored on the survey, less than 25 addressed by 2019.
And then one last thing, well, thank you for not charging for electronics.
That may not be my decision.
Bravo, Mark, on that. Okay, then the last thing is with those corner ADA things.
Yes.
Oh, who's responsible for the upkeep on those? Like if the cement starts cracking or they start heaving up, because, I mean, the city hires contractors to put those in.
Well, typically, just in general, we address those when we come to your neighborhood if we're going to do a mill and overlay. Typically, we're not going to be in your neighborhood about every 17 to 20 years to do that kind of work. And so if something would happen in between that time period, the homeowner would normally address those, if that answers your question. But, you know, just in general, they're, you know, 4-inch concrete slabs are floating. They move based on the amount of gravel that gets below them to get the water away. But in general, our city's got a good sidewalk system. But the sidewalk in front of your house or business is the responsibility of the property owner.
If I may, one more thing. The 55,000 water customers, is that including people who live in apartments?
I know that would be 55,000 meters. And so there's certainly more than that. Okay? So like if there was a 24-plex, we might have one master meter going into that facility at a 2-inch meter. We consider that one customer because we're only going to bill one person for it. Okay?
Thank you.
Yeah, you're welcome.
Are there any other questions for Director Connor? Well, seeing none, thank you for a very effective and efficient process of presenting a large budget. And as I mentioned earlier, I mean, much of our budget is focused in to public works and maintaining the city's infrastructure. So thank you for your efforts. Thank you for your presentation this afternoon.
Thank you for having us.
You're welcome. Okay, our next item is an item that we requested to have added, and that is going to be presented by Mr. Dave Bixler, our budget analyst, and the topic is City Council travel budget. Before we get started, I just want to make sure that I don't forget Mr. Bixler, and as while you're getting set up, I'll take up some of the time. But thank you very much for your response to our questions and compiling all of those. And councilors, I would just encourage, if you still continue to have questions regarding topics for our upcoming budget hearings, that you continue to channel those to Mr. Bixler. And we have encouraged the department directors to then return those to Mr. Bixler, who will then distribute them to us, as he did with this nearly 10-page document today.
Sorry about that.
That's quite all right. We're doing well with time.
Budget analyst. So what I pulled together today was some information regarding where the City Council budget has been coming in at. There's going to be some considerations for future expenditures. And so I want to put us, give an idea of where we are right now, year to date. So you can see through the years, 2014 through 2016, where we've actually come in to our budget, which is right around that. We were 2.4% over or less than 1% under. And so just to give an idea of how close we run to the budget. And you can see the fluctuation from year to year on the even years, just due to the fact that those are election years. And so we have quite a bit more expense in the city clerk budget. And these numbers represent the internal audit, city clerk, and the city council budget combined. So here's the estimate of the discretionary expenses or the variable expenses I took out labor and benefits, utilities, and any expenses that would be fixed. And so just the variable expenses make up about 27% of our budget. 70% of our budget is made up by labor and benefits. So looking at this, if with the savings that where we're at right now, we would have $61,492 in savings on a budget of $1.4 million, and that would be 4.2% versus a 5% goal. The factors into this budget were only the variable expenses. In 2017, estimated actual factors in audit travel for a regional conference and clerk travel for an election workshop. All our dues and membership expenses have been paid. Clerk publishing is expenses tracking lower than budgeted, and our council legal services we had budgeted at $12,000 has not been spent. The NLC travel is budgeted at $2,500 to $3,000 per person, and that depends on the length of the trip. And then city council, the entire city council budget is less than 1% of the general fund's operating expenses.
Thank you, Mr. Bixler. I just wanted to mention that Councilor Erickson and I have had discussions about our commitment of doing what we can to reduce our budget as the rest of the city departments have committed themselves to do. And it's difficult to do that in an already slim and trim budget. As you can see, our city clerks and our auditors are doing a good job of keeping their expenses down as much as possible and supplies that they use down as much as possible. And we are all committed, I believe, I'll speak on my behalf, I'm very committed, and I'm assuming that you are too, their continued education. Especially for our auditors and for our city clerks, it's important that they have the opportunities going forward and continue with those educational opportunities. In fact, some of them are required to maintain their certifications. So it's been one of the things that Operations Committee had discussed is our own travel budget for city councilors. And this is the appropriate time now that we're discussing budgets to have that discussion as a whole among the city council. And our proposal, and we want to now have input from everybody involved, would be to limit councilor out-of-state travel. And that basically affects the National League of Cities when it comes down to it. I know the one individual that would impact the most is Councilor Selberg, as he has yet to attend a National League of Cities function. I know I've attended one in 4 years, but again, I'm committed to doing what we can to reduce our budget as much as is feasible without hindering the rest of our staff. So it's time to discuss that particular topic. So our suggestion is the limitation of councilor out-of-state travel. Councilor Erpenbach.
So clarify that just a little bit. I don't disagree, but talk about remind us how many people generally go, and when you say limit out-of-state travel, what do you perceive that to be?
Typically, we send up to 4 individuals to the National League of Cities, staff and counselors. And our limitation is for 2018, I think it's with, 17, we can still save on our 17 budget, and potentially with 18, unless we see a big turnaround in our tax revenues. And Dave, you can address what that dollar savings would amount to.
The $61,492, or 4.2%, any additional expense we incur just lowers that dollar amount, and then that much is left. So we're moving further away from that 5% goal. Right now we're at 4.2. Any expense, we're just moving away from that 5% target. And I also just want to note that in the 2018 budget, all the travel is still budgeted. There's nothing that's been reduced from that budget. Just because it's budgeted doesn't mean it needs to be spent.
Correct. That's action that we could take in the future. Councilor Erpenbach, did that answer your question? Or
Not exactly. I want to hear from leadership. But are you saying, do you want no one to go at all? Or do you want to cut that number in half? Or do you want it to be just one council member? What's your vision for how this is going to be?
Our discussion, Councilor Erickson, you can address that as well.
And we've all kind of talked amongst ourselves a little bit here and there and talked about tradition as far as who goes, who doesn't go. The money is there. However, some of the conversations that we've had is that the administration is really tightening their bootstraps, and so we need to do the same thing. And what can we identify for us? And so that 4 or 5 people that go with staff potentially would go as well, and I think that's still on the table. But us as council to go, traditionally in the past, it's been if you go, you don't go the next year unless there's a spot open. So for example, I went a couple years ago. I could have gone potentially this year. However, for me, I choose to not go. I know, Rick, I don't want to speak for you, Counselor. I don't want to speak for you, but we both discussed as well that we shouldn't go because we're up for re-election, and if we lose, it's not a good source of money to be spent. You're termed, probably not the best source to go. The only person that hasn't gone would be Counselor Selberg, and so he's really the only one that would, in my mind, be up to go because he's never gone. And, you know, we did have 3 other new counselors that got to go the first year. It is very beneficial. I'll be the biggest advocate for it, that you learn a ton. You really, really do. The networking is fantastic. All of those things are great. However, we need to tighten our bootstraps. We can do other research. We can do things on our own to continue our own education as we move forward in a time where we really need to be getting close to that 5% cut of our own budget, because if it's good for them, why isn't it good for us? And so, you know, it's just a conversation for us to have amongst ourselves to try to figure out what does this look like for everyone, and should this be what we do. So if you take the 3,000 times the 4 people, that will give you the number that we'd save.
And to summarize what Councilor Erickson just stated, our suggestion or proposal would be that we would have no travel in 17, and then we would analyze 18 dependent on the revenues. And Councilor Erickson has stated that she has discussed this with Councilor Selberg, and so maybe if I may, Councilor Staley, if we could go to Councilor Selberg just to see how he feels about that, and then we can come to you.
I don't have any problem. I mean, it sounds well thought out. Like you say, we all have to do our part. So if I have to take one for the team, so to speak, well, that's fine with me.
Well, and it may not be fun to attend a conference on your own as well, too. But Councilor Staley.
Well, yes, and actually, I'm the one who, I was asking about it last week because I know in the past, like Councilor Karski, I think went 3 times. I don't know that there has been anything in place that said a person goes once and then once every 4 years. There's nothing, no policy. I will just say, I went there last year with Neitzert and Councilor Starr. It was fabulous. And I don't even care about networking. I'm talking about listening to other municipalities talk about what they are doing. It's breaking out of the box. It's hearing new, fresh ideas. And I think that's going to help me be a better counselor. So I think for the taxpayers, I got their money's worth. I was going to all these things. I gave many presentations about it. It was not wasted money. So when I asked about it last week, because I thought if everybody isn't going, absolutely somebody has a right to go, but if they're not going and we have that opportunity, I was told, well, there's been discussion that it's not going to happen, and I haven't been talked to about it, Councilor Erickson, because you said you've been talking among yourselves. No one said that to me, okay? So that's fine if we come up with that now. That's why I think we're having a great discussion here. I would encourage Councilor Selberg to go. I would encourage all of us to go. I would like to go back out to Pier and go to some other things out there. I mean, there's other things locally we can do as well. But I think this thing is so beneficial, and I would hate to see it taken off the docket totally. So if we're not doing it for a year, that's great, but it's a wonderful thing. It's a great, too bad we can't all go to the same sessions together and hear the same thing. So that's my 2 cents.
Thank you. Councilor Erpenbach?
Well, I just would continue that because I have gone to the National League of Cities one time, but then I also went to a small group on economic development that wasn't, it was National League of Cities, but it wasn't the large group, and it was even more beneficial to me for my learning style. It was spectacular, and I was a very new counselor, as Councilor Staley was last year, for that particular event. So it was hugely well-spent money. My other question then is, you're talking only about cutting the out-of-state dollars for travel. What about those in-state dollars? I mean, many of us now, I mean, we're all on municipal league committees. I hope that we're all doing them by phone, that we're not any of us driving to Pier for that 1 hour or 90-minute meeting. I hope that we're doing that. But then there's the convention, too. Do we want to limit the number of people that go to the convention? I mean, I don't know what kind of impact that is. Right, go. Sorry.
Well, this year, it doesn't have an impact since it's held here in Sioux Falls. And we would have to analyze that again then for next year. But we're not suggesting that we would limit the in-state travel, because we do believe that our participation in the South Dakota Municipal League is very important for us. I mean, they are our contact, especially during the legislative sessions. And I don't think anybody would dispute, I certainly would not, the value in the National League of Cities convention, because the year that I did travel, I greatly enjoyed the presentations that I attended, and enjoyed having the opportunity to come back and report to my colleagues as well as to city directors too. Councilor Erickson.
Thank you for mentioning that, and that's what I was going to say. The benefit this year is it is in Sioux Falls, so we have no hotel or any of that. I'm still on the Municipal League Board and your representative for the council.
And that doesn't cost us.
And that doesn't cost us. That's included in our membership that we pay, and so nothing comes out of our budget for that. The other thing that I want to just remind all of the council that when Councilor Rolfing was chair, he did mention this very well thing, that we're talking about tightening our bootstraps, we're talking about cutting travel, we're talking about all of those things. So this isn't the first time this has been discussed. We've all heard it, and I believe it was even in notes of something that Councilor Rolfing, that's not listening to me right now, but something that he did either have in an email or in notes, and it was mentioned in meetings. And so I just don't want anybody to be caught off guard or surprised. And this is why we are talking about it right now. No one's saying that this continuing education isn't beneficial, because it is. It is phenomenal. It's great. But we need to have those conversations here and kind of figure out if this is something that is worthy or not.
And I think, as Councilor Erickson mentioned, we do have to make decisions, and sometimes it's hard to make these decisions, especially when you're looking at cuts, because you're going to inevitably cut things of value. Regarding another comment regarding the in-state travel, one of the things that was discussed within operations when I was still the operations chair was we can do as a council a better job of consolidating our trips and traveling together. And if you recall from the notes, it was decided or it was proposed at that point in time that when a city vehicle is available, the expectation is the councilor will ride in that city vehicle. If he or she elects to take their own vehicle, it's with the understanding that it's their own expense at that time. So we are trying to do what we can to limit our in-state travel costs too, but we're not suggesting that we do not attend our Sioux Falls Day at the Legislature and the other events that do take place during that particular point in time. Councilor Erpenbach?
If I might, just one more thought. And again, I'm not questioning this. I'm trying to think through it. But one of the things, you started this conversation by talking about our clerks and how we don't want to back down from the education that we provide for them. And I wholeheartedly agree with that. We absolutely need to continue that. We have to remember that the National League of Cities piece is the only place where our other staff has an opportunity for city-related education. They aren't doing, they don't have the certifications, they don't have those same requirements. So I would maybe just toss out this idea of maybe we cut in half what we do. Maybe we, those two staff members, that's their primary form of education or travel education, they take turns going each year and maybe just one council member goes, so that there continues to be some sort of presence from Sioux Falls, because there was a long period of time where Sioux Falls had no presence at the National League of Cities. And that I thought was terribly unfortunate. I was glad to see that we got back to doing that. But I just wonder if that isn't maybe one way to do it, because I don't want to lose that educational opportunity for the rest of our staff as well. So that
Okay,
would
and just
be
to
my thought.
clarify, other city staff, you're referring to our city
Yes,
council
sorry.
staff, Mr. Bixler, David, and
Jim David.
City Clerk Greco.
No,
Jim
I'm talking
David.
about Jim David and David Bixler,
Okay.
those two folks.
Okay.
In terms of, I know that Mr. Greco has gone to National League of Cities, but I would put
Right.
him in the category of needing to
Okay.
the other.
Any other comments or discussion? Because it seems like we have reached a consensus. Unless there's a discussion that they would like to have in terms of cutting it in half, is there any other discussion regarding that proposal?
I would say that I would support staff still getting the opportunity to go as well, because this is their one training time as well. And that was part of just people talking about it also. So I certainly would be supportive of that. And a lot of it depends on schedules and families and things like that, that it doesn't always work.
And I would agree with that as well, too. And I think we could leave it up to our staff members to make that decision. Okay?
I just want to be clear.
So I think we have direction. Mr. Bixler, anything else to add?
Yes, I would just like to be clear that for the South Dakota Municipal League Annual Conference, there will be a registration fee.
Yes.
So we'll pay that, but that's all we will incur.
No, we can't crash the party. Any other comments or points of discussion on this item? Okay, I think we do. Are we in agreement? We do have direction on how to go in terms of our travel.
Maybe just state it for us, what you see as
That
our.
we are limiting, from what I take from this, that for 17, I'll speak 17 since we haven't addressed 18, that we are limiting counselor out-of-state travel, and it's going to be the option of out-of-state travel for our staff, and we continue to support the travel that's necessary for certification and educational opportunities for our assistant city clerks, as well as our auditor and assistant auditors. I believe that's what we pretty much agreed upon. Okay? All right, very good. Thank you. And our last item this afternoon, 2017 Prevention Services budget, and Vice Chair Christine Erickson is going to address that.
Thank you. And this is really just meant as an update as we, as the fiscal committee, walked through this. Councilor Rolfing, Urban Starr, and myself were on that. As we heard last year when the Prairie View Prevention Services were cut, we walked through that as a committee, and we did the report was done, and we said till June, and then we've kind of moved on. Since that time, that wasn't the end of it. Since that time, we've continued to talk to the county and the school district to try to find a way if this is our role. And so in front of you, I have what was given to us, and this is, again, just for information. Just want you to be aware of this. We did not spend all the dollars for 17. Those dollars at this point would just be absorbed into the budget, or this council could have an option to add that line item into the health department and say, hey, it's important for us to be addressing prevention services in Sioux Falls. I know one could argue that, is this the role of government? Is prevention services really the role of government? And upon looking at some of the city stuff, our health department does have it stated very, very openly as far as what what their Live Well role is, and I'll read that to you. Live Well Sioux Falls is a community-based initiative designed to help improve the health and well-being of Sioux Falls residents by collaborating on projects to address health needs. The Live Well Sioux Falls Coalition, a group of diverse businesses, is instrumental in guiding our efforts, and that's right from their livewellsiouxfalls.org area. And so I share that with you because when someone questions, is this really the role of government? I can say, yeah, sure, I think it's far more our role for drug and alcohol prevention versus talking about fruits and veggies. What is our role? Are we going to pay for it on the back end with addressing it through community health and law enforcement or prevention outreach? We even heard our director talk about prevention today as well, and I think it's been mentioned by many of us also. So I'm not advocating at this point, may sound as if I am, but I want to challenge you all to think, is this something that those 2017 dollars should be spent or should not be spent? Again, this in front of you is a one-year pilot program. It is very specific. It was provided from Aaron Sertzka with the county. As far as their roles, they do a lot of prevention work in our community already, and that is definitely one of their roles. And so this would be a city-county school pilot project. There are dollars at the bottom of it as far as what would be budget. Again, this is just something that was presented to a collaborative regional government group that a few of us get together on the mornings once a month. And so as we've talked through this, you know, I can see the need that we certainly have to tighten our bootstraps and do that. But if you look at the return of investment on one kid that goes through the court system, basically pays for this program. So if we can get them early and prevent them from drug and alcohol and or other things. We also heard today by the director that the opioids and those drugs are now going up in cost. And so we are throwing money at addiction versus trying to prevent it. And so again, I just challenge you all, look at this. We can talk amongst ourselves again and think about if this is a line item that needs to be brought forth. I'm happy to answer any questions. If any of you have any questions about this as well. The one area of resistance that I know was brought up is that the school board, or the school district is not at the table at this point. And so if it was more of a divide and conquer, maybe there would be more support from that. We're not to that point either, and we're coming close to an end. This project right here could be put in play and implemented in October, as quick as October. And so there's still talks with the school district because they're having issues with truancy and how important it is for kids to stay in school and the issues of getting in trouble when you're not in school, not graduating, helping with graduation numbers as well, and those funding mechanisms that are linked to being in school. So happy to answer any questions. Otherwise, take a look at it, see what you think, and we can talk more.
Questions or comments for Councilor Erickson? Councilor Urbanbach?
So really, just to clarify, this isn't a 2018 budget proposal at this time. It really is just talking about adding a line item back in to the 2017 dollars. So.
Correct, for those unspent funds. The money is already there.
Right.
It's just a matter of transferring it from the police budget to the health budget and saying, can you do this? Is this your role? And I mean, I think they make a great case for themselves, and I think you even heard them say it today. It was in the slides of the health department talking about prevention services, and is it our role to be talking about health and wellness, or is it our role to talk about drug and alcohol prevention? It's not a really sexy item to talk about, but I just don't think we can put our heads in the sand and do nothing as we see crime on the rise.
Any other comments or questions? Okay, seeing none, I first want to thank our loyal staff for sticking around for these last two items. You are loyal servants, and thank Mr. Sneevy for coming back for these last two topics. So just a quick reminder about our third round of budget hearings will take place next Tuesday, August the 15th. Can't believe it's going to be the middle of August already, but those are slated to begin same time as the hearings did today at 3 p.m. So next Tuesday, August 15th, 3 p.m., third round of budget